Ji, Assalamu alaikum everybody. It's a real pleasure to welcome all of you to our second International Research Symposium. I would like to ask everybody to mute yourself if you're not speaking, please. And
Zinat,
I
I
will
share
ask,
your screen also.
am I not sharing my screen?
You are sharing your screen, so you,
I'm going to stop sharing in a minute. Ji.
okay.
Ji. So we have a great program line in front of us. We have an excellent presenters here, and this is the program outlined over here. The program is going to start with the dua. These are the course directors, Dr. Rahat Naz, Dr. Nazir Khan, Dr. Irfan Suleiman, and of course Tariq Rafi, our Vice Chancellor. We will get 4 hours of CME for this program, and for that, we will outline the process. The program is going to start with the dua for the all the departed soul, and I would ask Dr. Yunus Ismail to kindly start with the dua.
أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم لا يكلف الله نفسا إلا وسعها لها ما كسبت وعليها ما اكتسبت ربنا لا تؤاخذنا إن نسينا أو أخطأنا ربنا ولا تحمل علينا إسرا كما حملته على الذين من قبلنا ربنا ولا تحملنا ما لا طاقة لنا به واعف عنا واغفر لنا وارحمنا أنت مولانا فانصرنا على القوم الكافرين. I just recite the small portion of the last verse of the Surah Baqarah, the translation of which is Allah requires not of anyone that which is beyond his capacity. He shall have the benefit of the good he does and shall suffer the consequences of the ill he works. Supplicate therefore, Lord, take us not to the task if we forget or fall in error. Lord, place us not under responsibility in the manner of those whom thou didst place under responsibility before us. Lord, burden us not with that which we have not the strength to bear. Overlook our defaults and grant us forgiveness and have mercy on us. Thou art our master, so grant us succor against those who reject thee. So these are the small verses, and I recite these verses because we are going through the pandemic, and the most affected community this pandemic is the healthcare workers, or the which is called the frontline worker. These are the silent soldiers who are fighting the disease uh, uh, only with their hands and with their ability or skills. And with this, we saw a lot of the physicians, not only in the United States, but all over the world, who sacrificed their lives to save the humanity and for the healing of the humanity. The latest CDC report, which was released on the 22nd of December, mentioned there in US alone, there are 955 uh, healthcare workers, which include doctors, nurses, paramedics, and other aides, which sacrifice their life. And altogether in United States alone, there are 288,000 healthcare workers who are affected. So we remember this movement. We are using this movement to remember all those who sacrificed their life in the last 1 year. And we ask all the participants to join us in a silent prayer for the disease, for the soul of the deceased. So just join in the silent prayer. Ameen.
Thank you, Yunus bhai.
Thank you very much, Yunus. I appreciate it. We all do. It has been a hard year for all of us. It's not our normal year where we practice and take care of our patients and take care of our work and home. Everything has changed, and as NPR News, they were talking about it, that the forecast is this, that we're going to see some repercussion of this COVID-19 pandemic for the next 2 to 3 years. So it will take up to 2 to 3 years for everything to go back to where it used to be. So it's a long time, and we all have to still um, endure it and be brave about it. I'm going to next ask Dr. Tariq Rafi to say a few words for this symposium.
Bismillahirrahmanirrahim. Nahamdu wa nusalli ala Rasulil Kareem. First of all, let me thank you, Zinat, and all the participants who have taken their time out for this very important research symposium that you have organized. GSMU alumni of North America has been in the forefront of organizing such academic activities. And these are something which is very much needed for any university to progress. These programs add a lot to the improvement in the studies of our students and to our faculty also. And there's a great deal of learning for all of us. Unfortunately, as you said, the COVID-19 has struck us very badly. Physical meetings are impossible. But with this technology of webinars and Zoom meetings, it has been possible for all of us to be together and to meet and discuss. Now, this COVID shows the importance of research. This research brought us with the vaccine to save the humanity. If there would have been no research, it would not have been possible. And within a year time, which is, I think, the shortest possible time that the pharmaceutical companies with their research products have come over with the different vaccines, different companies have come over. This is the importance, significance of research. This is how it can be used for the benefit of mankind and humanity. Unfortunately, no Muslim world, with lot of resources, lot of money, has been able to do any research of this kind. We have been involved in phase 3 trial, but only as volunteers. None of the Muslim countries have been able to do any research or bring about anything. Still, it comes back to America and the European countries who have done it. I look forward and I pray that in our lifetime, our countries, the Muslim countries, especially Pakistan, will be able to contribute something to the research. These activities of yours, Zina Safdar, that you have organized, along with all the participants who are here, I'm thankful to all of you, Irfan Suleiman, Rizwan Naim, and others. And I think this effort of yours will bring about some improvement in our research culture. And I hope that in the next generation to come, Pakistan and other Muslim countries will be in the forefront of research. With these words, I won't take much long. I will just request all the participants who are there to listen to what it has to be said by the speakers and to improve their knowledge with their wise words. Thank you once again. Thank you. Pakistan, Paindabad.
Thank you so much, Dr. Tariq Rafi, for, it's been an honor to work with you. You have always been a supporter of Jason Miana and of all our efforts. So we really appreciate it, sir. So next I'm going to ask Rahat Naz, Dr. Rahat Naz, if she would like to say a few words. You're muted, Rahat. We can't hear you. Ji.
Thank you, Zina. First of all, I would like to say thank you to my alumni for their constant support in arranging various academic activities like online lectures, webinars, and research conferences for the last 2 years. We're thankful for your support in collaborating with us for these research conference, and it's wonderful to work with you and Irfan Suleiman, a very energetic team, including all of you, Rizwan Naim, Nagmana Shafi, endless names. So it's an honor for me to be a part of this energetic and hardworking team. And I'm really thankful throughout the last 2 years or more years for your contribution, and especially arranging the conference. It's a very hectic sort of a work, and it adds a lot to our students, and it gives them a platform to go for the research, and I'm really honored to be a part of your team. Thank you very much, Zeenat, for all your support, and my special thanks to Irfan, Naeem, and each and every one of you, especially our speakers. They have contributed a lot by taking out their time and preparing these important talks for us. Thank you.
Thank you, Rahat, for your kind words. I'm next going to ask Dr. Nazir Khan. who's the chair of this conference, also spearheads the research at JSMU, to say a few words, please.
Alhamdulillah Rabbil Alameen, As-salatu As-salamu ala Arshafil Mursalin wa ala alihi wa sahbihi ajmeen. Everybody listening, is okay? Sound is okay?
Yes.
Okay. Okay. Now, I just briefly, as Dr. Zinat asked me to give a brief description about the research activities of Genus and Vega universities. So I start with the undergraduate. For undergraduate student, we start the research activity from second year. So second year, third year, fourth year, and at the end of the fourth year, they do a research, field research, and they present it, and they send the report. So from second year, they teach that we teach him how to do the research methodology, statistical package of social sciences, and all the how to compute the data. These are all these things we teach in second year, third year, and fourth year. If a person wants to do research other than the mandatory, they can do it. They make a group and they come to me, and I'll guide him how to do it. This is the undergraduate research activity. After that, in the postgraduate, we have the students have to submit the synopsis or whatever it is to the institutional review board. The institutional review board, we have about 15 members who are here, and we have different discipline and specialist, specialized people who are there. We also have a religious person. We have also a legal person who are there. If there are any synopsis come which is related to some legalities there or something about religious matters there, they also guide us how to do it. In this institute board, as the international rules, there is no person who is really in such a position who can change the direction of the decision. For example, no directors or a person who is in the higher post can be in the institute review board, except the director of research, which I am the director of research. I am as a co-chairman of this institution review board. No studies can be done in the JSMU without the approval of the institution review board. Then after that, we have our journal, Annals of Genus and Megan University. And I'm happy to tell you that this year, our journal has been recognized by the Higher Education Commission with category Y. This is because a lot of journals do not have the this recognition, and according to the new rules, if the journal is not recognized by institution Higher Education Commission, it is not considered for promotion. So therefore, after our approval from the Higher Education Commission, we have a lot of articles coming to our journals. Until now, we have used to have 2 issues every year, but now because we have more people, more articles are coming, so we are going to change it to 3 times a year. That means after 4 months, we are going to publish a new issue. We also have advanced studies and research board, which is the highest body, and the honorable vice chancellor is the chairman of the board according to act of the university. In this advanced board of studies, we make the rules and regulation about the postgraduate studies. No studies of the postgraduate can be implement in the university except other than it is approved by the Advanced Studies and Research Board. We also have the international relation. We have also had the Department of International Relation under the research department. So for any university or for local or international, if you want to do a memorandum of understanding or facilitate our student or there, we can have according to this in this department, we make the rules about it. We also have the postgraduate facilities for our funding. all the postgraduate student and faculty can apply for research funding, and we provide him up to our research committee can approve 100,000 rupees. But if the person needs more, they can apply to the vice chancellor, and the vice chancellor can go up to 300,000. And if it is more than, if the research department, the person needs more money, the case will go to the syndicate, and it will go up. There's no limit about the syndicate. If it is a big funding, syndicate can approve a big amount of this thing. So, but unfortunately, right now we do not have any funding for the undergraduate students. We are thinking to do it, how to we can facilitate to undergraduate students from the next year. We also have the HSC funding through through our research department and registrar. If a person wants to apply a big amount of the money for funding, they can apply through the research department and registrar department to Higher Education Commission. These are the briefly the activities about research department and the university for the research department. So thank you for inviting me to say a few words about in this conference. And we are really thankful to Dr. Irfan and Dr. Zinat for organizing this conference, especially Dr. Irfan. He started last year. It was a very successful conference, but unfortunately, due to this pandemic, we are going to have this virtual meeting. We hope that this will go soon, and we can have meet next year. Thank you very much.
Thank you so much, Dr. Nazir Khan, for these words. And inshallah, next year we will have, inshallah, a research meeting which will be, in person. We'll be there and be talking to you in person and talking about collaboration. And of course, I want to thank all the course directors for this meeting, for organizing the meeting, and for JSMU for the 4 credit hours that you will get, and also for Chicago Medical Society for the AMA category 4 hours that you will get. And I also want to thank the alumni executive committee, which is outlined over here. And I'm not going to take few words, but I just want to acknowledge Dr. Tariq Rafi and give him the Lifetime Achievement Award from the alumni for all the hard work, all that he has accomplished in this few years of time, converting SMC, Sindh Medical College, into a university status and establishing multiple institutes, and also for being a big supporter of JSMU. Thank you, Dr. Tariq Rafi. Thank you for being there and for allowing us to be part of the JSMU even after we have graduated, and for supporting our alumni. And of course, your plaque is going to come. Hopefully, we will get it to you soon. But thank you, Dr. Tariq Rafi, from all of us, the executive committee of JSMU.
Thank you, Zinat. Thank you. Thank all of the executive committee. Thank you, Zinat. And I'm really humbled by this award that you have given me. What I did was my duty. I fulfilled my duty with my utmost honesty, and I try to do whatever I can. And this is, you see, everyone just has to do what he has been given the task to do. If each one of us perform our task to our honesty, I can assure you that Pakistan, in a very short time, will be one of the developed countries. Unfortunately, we are not able to achieve that. But I'm really humbled, and I'm really thankful to the JSMU ANA and to you, Zinat, for giving me this award. Thank you once again.
Thank you. I mean, remarkable work you have done. And the second, I just want to also acknowledge with deepest gratitude to Dr. Irfan Suleiman, who's the president in 2019, for all his work that he has done. He's really put a lot of sweat and hard work. I mean, this is really his work that we are looking over here. I mean, he has forwarded the educational mission of JSMU, the research mission. His first research conference last year was very well received. He had a lot of abstracts that were presented by the students, and there was a competition, and there were oral presentations. So really the caliber of that conference, I was not there, but I heard and I've seen that the caliber of that conference was very, very of the international caliber, like we see over here. And he also has worked on the video lectures, which are continuously being recorded. Up till now, we have more than 72 lectures which are recorded. They are available online for everybody. There's no password protection. Any medical student, any student can see it. He has also fostered collaboration with the Canadian Society to give the Apna Institute of Public Health lectures, which is going to be starting soon, and also the winter meeting. So please, Irfan Suleiman, we want to give you, just Miana want to acknowledge your work.
Thank you so much, Zeenat, and thank you so much, Executive Committee, GSM Yana. But this is all team effort, and it's not possible by one person. This is all the big support of GSM Yana leadership and the Executive Committee and the membership. And also, it's impossible without the support of GSMU, Dr. Tariq Rafi, Dr. Zeenat Saf, Dr. Rahat Naz, and Professor Nazir Saab. They all are very helpful, very supportive, and I think this is the vision of Dr. Tariq Rafi to do some research activity, and inshallah we will continue to do this. Thank you so much again.
Yes, thank you, Dr. Irfan and Dr. Tariq Rafi. I mean, it is really an honor that he is our Vice Chancellor, and he has really taken us to the next level, our university to the next level, now bringing it to the international caliber. So, I mean, this research, I'm just going to say a few words. I know we are behind by a minute. Just that this is truly an international collaboration with speakers from US, UK, Saudi Arabia. We are getting the CME credit for this. And these are a lot of educational activities that we have done for the year, in which included seminars, webinars, young physician seminar. We had a career seminar, which was very well attended. We are in the process of developing public health online courses with Irfan Suleiman helping to establish those. The CME is obtained for the credit hours is obtained for the lectures at JSMU. We are part of the Apna Merit program. Genetic lab is being set up, and that is with the help of Dr. Rizwan Naeem. And we are having this international symposium. We have developed on an organization level at JSMU. We have a new website which is up and running, which is combined all the data from the previous websites. We have many new members which are joining in as lifetime members of JSM this year. We have developed a comprehensive database of all our members. We had elections this year that were not there for many, many years before. More than 70 lectures have been recorded from faculty all over the world, actually. And that has contributed to the learning of the medical students in Pakistan, not just JSMU, but all over. And we have our first educational, first Zoom general body meeting, which is also a first. So on the philanthropy, I think we have collected and distributed PPEs and N95 masks, not only to hospitals in New York, but also and being acknowledged for that, but also to JSMU and JPMC in collaboration with Apna SWRC. And we were very happy that we were able to contribute. We have had multiple seminars and webinars on COVID education. We have contributed to the food pantry project, and we have also provided COVID relief funds to the alumni in Pakistan. And we have facilitated collection of emergency funds for the class of 1984. So I really want to thank my executive committee. All this would not have been possible if my executive committee was not with me in supportive all the way along for all these projects which we have been able to complete in this difficult time of COVID. So special thanks to Yunus Ismail for being there, for helping, always there. He's still there today. The next year he's going to be the president, and we're hoping that he will, and I'm sure he will take this forward and continue with all the educational activities and research activities that we have been doing this year. And Malia Ehsan, who's going to be the president-elect next year, and Arif Shafi, and of course Irfan Suleiman. And Dr. Rizwan Naeem has been a great help and a supporter, guiding us through this process and telling us exactly what is allowed by bylaws or not. So we appreciate Rizwan Naeem for his dedication to our alumni and all the committee members. So with that, I'm going to go and just introduce just some rules for the meeting. All the questions, please put in the chat box, and you can also email them at askjasamiana@gmail.com For your CME credit, please send an email to askjismiona@gmail.com and you will receive a survey link. Please complete the survey. After you complete the survey, allow 2 to 4 weeks to be for the CME to be certificate to be emailed to you. If you don't complete the survey, then you will not get the CME credit for it. So please be sure to do that. And these are the program which is outlined over here. I'm not going to read it. You can do that on your own. And the first talk is going to be developing interpersonal communication skills by Dr. Shazia Maqsood. So I will ask Dr. Shazia Maqsood to start sharing her slides with us, and then um, to start her talk on how to. Can I ask Rahat Naz? Can you do me a favor, Rahat? Can you introduce Dr. Shazia Maqsood, please? You're muted, please.
Dr. Shazia Maqsood is our alumni. She belongs to JSMU and she is my niece. And she is really working very hard. And for the last 2 or 3 years, she is putting constant efforts towards our alumni, be it a lecture recording or arranging a webinar or giving a talk. So we are really thankful to Dr. Shazia Maqsood for all her efforts. And she is working in Saudi Arabia for the last so many years, and both as in the Ghanaian ops field as well as in an administrative role. So I think I should not let Shazia wait. So Shazia, thank you very much for all your supports. We are proud of you.
Shazia, are you muted?
No, I'm fine now. Hi, assalamu alaikum, everybody. Sorry, I think I got logged off. How's everyone?
Bilkul, very good. We don't see your screen, G.
Okay, can you see my screen now?
Yes.
All right, okay. You all can hear me loud and clear as well?
Yes.
Bismillahirrahmanirrahim. Assalamu alaikum, everybody. Thank you, all the course directors. Thank you, all the executive committee members. It's been heartening and endearing to be a part of such a great team of members who are on the ground at the grassroots level for spreading education to the masses in Pakistan. And I'm very glad to be part of your team. Today's talk is mainly about communication skills and how to develop interpersonal communication skills. It has been specifically designed knowing that our doctors, our nurses, and our medical students are our assets and the hardest working core team on the ground level. So we understand that we see medically complex cases. We are always short of time. We have got so much multidiscipline to put into an effort into seeing the patients that we need tools to brush upon our communication skills to do the job as specifically and as importantly, effectively as possible. So now what really starts around as a relationship with the patient is that as a doctor, unless we are spick or span with our empathy, we can be clinically a very sound doctor, but we could be a bit judgmental. And if the empathy is lacking, that will hamper our rapport with the patient. And the fact that either way, we are not going to be able to justify the care that the patient needs. So it's just as you always aim to improve your own medical knowledge, we would really emphasize that likewise you can improve your communication and your listening and practicing skills as well. So the tactics we are going to discuss in today's 30 minutes talk, or rather 35 minutes talk, is we will help you to become that extra effective clinician that you may dream of becoming one day. I remember I was teaching a group of medical students, and I asked them what do they aspire to be when they are when they have graduated, and one of them said, I want to become either a neurosurgeon or I want to become an orthopedic surgeon. And I asked them why. And without giving it second thought, he said, because they are the richest doctors in the world. And that hit me very hard. As team leaders, as teachers, it is now our responsibility not only to train our medical students and our junior doctors to be skillful, because believe you me, I sit in the interview board in Saudi Arabia, and Pakistani doctors are the most skillful doctors out of all the communities that I see. But what's lacking is empathy. When they come on board, what's lacking is proper communication skills. That's what we're going to talk about in our talk today. So in teaching something which is typically not taught, empathy in a sense is how we let the patient know how much We care, and we are worried about them, and we want them to get better. So that's the most important thing that empathy teaches us. And effective communication will not only help you in your daily patient interaction, but it will also help you with your colleagues' interaction. It will also help you with your superiors and your teachers' interaction, and also in your interpersonal relationship at home. So it is a widely encompassed thing that, you know, having better communication skills not only make you a better doctor, but will also make you a better human being. Okay, so I belong to the batch of 1993 from JSMU, and I'm working as an OB-GYN residency training program director and a quality administrator in Dr. Suleiman Al Habib Hospital Group in Saudi Arabia. What we aspire to teach you today is a cleverness-based medicine. Now, what is cleverness-based medicine? It's a good medic would treat the disease, but a great medic would treat patients who have the disease. And there's a slight difference between the two. And the next few slides will be about how we come about, overcome our shyness, and become a better medic. So the goals for today's talk are to practice more comprehensive consultation model. On your left is a consultation model in gray, in between is a one in blue, and in the corner is a one in green. And we are trying to shift the paradigm from here somewhere to the green one. So now, you know, I mean, what happens typically on a day-to-day basis is that a patient comes in, we have a chief complaint, we take a history, we got through the systematic review and a family history, so on and so forth. Then we do a physical examination, and then we plan a management. Sounds like a very perfect doctor, isn't that right? But in actuality, we have to establish a rapport. We have to build the rapport, and we have to make using of physical examination, you know, to empathize with the patient. And empathy comes with mirroring the patient. So like if somebody is coming with pain, you empathize with them, you lower your voice, and then you empathize with them, you know, just sneaking your eyes a little bit and say, I understand that you're in pain, or I understand you're in agony, or what happened, you don't look very well. So these kind of small sentences puts the patient in ease, at ease, to be able to converse with you and to be able to open up more with you with their symptoms. So again, there's a partnership, closing and maintaining the relationship and preparation. So if you are used to reading any books outside your medical field, you will know that a business strategy is that one good customer, and we take it as one good patient, will go and talk about you to 9 other people, who will in turn talk about to 9 other people. But one bad patient will go and talk about you to at least 20 other patients or 20 other relatives, who will then talk about 20 more. So the escalation cost of a bitter experience at consultation is more than a better consultation. Let's put it this way. So do your best, you know, to not only to acquire knowledge, because without knowledge you won't be able to communicate properly, but at the same time, don't be intimidating to the patient, because the patient already understands that you know more than them. But at the same time, do not, and I repeat again, do not undermine the power of social media vis-a-vis Dr. Google. So most of the patients nowadays, they come to you, they already have their diagnosis partly in their mind, and probably they are right. I'm not saying they're always wrong, but also at the same time, this is the modern age of consumer-oriented medicine. So the patient really know their rights more than their responsibilities. So we have to be very careful. And good communication skills and good rapport with the patient and good empathy with the patient will also protect you from unnecessary litigation. Remember my words, and we'll talk about these in the next coming slides. So what is patient satisfaction? There is no going back to the patient satisfaction. You put yourself first. Patient care is more than just healing. It's building a connection that encompasses mind, body, and soul. So I have a few videos which we will talk about. If we have time at the end of the presentation, we will play some videos about empathy, about breaking bad news, how to do it a good way and how to do it a bad way, so that you can compare between the both of them. So let's talk about communication now. I mean, communication is something on a day-to-day basis. We get out of a bed and we start communicating with our relatives around us. We come to our work, and then we communicate with the colleagues around us, and then we see patients and so on and so forth. Keep in mind, 55% of that communication is our body language. The way we throw our tone, the way we use our eyes, our hands, our facial expressions, 55% of that makes your communication. Then 38% is your tone, the way you talk to the patient, you talk to your colleague, talk to your friend. So like some people have a very authoritative tone from the very beginning, and they would intimidate you as a patient, as opposed to, how can I help you today? Or you do not look very good to me, how can I help? So lowering your tone where it is needed and raising your tone where it is needed. Say, for instance, where do you want to raise your tone? When you are in a teaching scenario, you're teaching some obstetric skills, or you're teaching some emergency skills, a difficult intubation. So at that point in time, if you're working as a team leader, then you need to raise up your voice that, are you okay? Are you okay? That is the time you raise your voice. So you as a clinician not only need to know your knowledge, but you also need to know how to properly throw your voice for your own benefit. Folks, some of you have yourselves on unmute, and I can hear your conversation in the background. So I'll be grateful if you can mute yourself, please. Thank you.
I have done it.
Great, thank you. And 7% of the talk is verbal. Now, I read somewhere that, when somebody comes to a doctor for a consultation, and when you're talking to them, remember, you may have about 10 to 15 minutes of that consultation time. Some people may take less, some people may take slightly more of that, but more or less all over the world is acceptable, a 15 to 30 minutes consultation time, depending on the faculty you work in. So when you are verbally talking to the patient, the main take-home message will only be 30%. Whatever you talk from A to Z, the patient will only take home 30%. The rest of that would be your body language. And that is why we always say, always furbish an information leaflet to the patient, or talk to them about help groups, or talk to them about any websites that might help for their condition, because they won't be able to remember whatever you have told them. So always jot it down on a piece of paper and give it to your patient. You will come up as a better doctor in comparison to another doctor that the patient might have seen. The social media is a very, very transparent, but at the same time very difficult and dangerous platform these days, because whatever you do, people talk about you on the internet, and if it is negative, it goes in a very wrong way. So we will practice how to avoid all those pitfalls as well. So these are the 5 C's of your development, my development, everybody's development, that we need to have competence. Like without essential knowledge, we cannot move forward. But we need to also have a character. And what is this character? When we are talking about character, when you pray your salah, you go in sujood and you are praying, Ya Allah, give me the strength to make right decisions for my patients, give me the strength to make right decision for myself and my family. So that is your character, that if you are sitting in your office and making a decision for your patient, it should not be dependent upon the type of insurance the patient is carrying, or the type of words that the insurance doctor is wanting to listen from you, or a changing of an ICD code to promote or facilitate the patient, or writing medications for the patient when the patient does not need it. So this all comes with character building. And if as a student, if you learn this, you will go a long way, inshallah. Also, collaboration with your colleagues, communication with your colleagues, and commitment to your work. Now, some people, as I mentioned earlier, but with that example that medical student wanted to become a neurosurgeon, or wanted to become an orthopedic surgeon because it was a highly paying job. So again, the commitment, what I tell the medical students, what I tell the junior doctors is that if you feel that you are coming on work today and you're owning your workplace, that means you're in the right place. And if every day you have to drag yourself to work, you need to reflect on that. You need to have a bit of a reflective practice to see where things are gone wrong. And reflection is something that you need to do every night before going to bed, to see if you have been harsh upon yourself or harsh upon people around you. So learning communication skills, learning to empathize with the situation by getting into the shoes of the opposite person who is upset, who's angry, or who is in pain, helps you a great deal in your personal relationships as well. So most of us, When we are with friends, we love to talk, talk, and talk. But by default, a human being is made to talk and to listen less. With the help of such workshops, with the help of such talks, you'll be able to listen more. And listening creates an aura around you of friendliness and open-mindedness. If you're non-judgmental and your non-verbal clues to the person who you are listening to are positive ones, you leave a good impression on the person and you make a good rapport. And once you master the art of communication and effective learning, it means that you will repeat it again and again and again on a daily basis. And at some point in time, you will start bearing the fruit of that, inshallah. So communication skills for the healthcare workers are even the more important because we are not dealing with mechanized life around us. We are dealing with human life around us. We have to deliver information to the patient effectively. We have to work as a part of an integrated multidisciplinary team. And we have to engage in an appropriate what-if conversation with the patient. So for that reason, you have to have some sort of skills to be able to do it correctly. Now, the art of sailing through the art of sailing against the tide is called good and effective communication skills. So basically, we are dealing with uncooperative colleagues at work. Sometimes you're coping with stress at work and at home, and you don't have to mix them together. That's what you've been told. You have to keep the seniors and bosses satisfied. Any surprises at work on a day-to-day basis. We need to learn essential of good communication more than other professions because the patients are human with sensitive needs. And we cannot practice medicine without effective communication skills. And the poor communication will cause a lot of medical, legal, and ethical problems, as well as giving you a bad image in front of people around you. So, what about hearing as opposed to listening? So for your listening skills, please look eye into eye to the person that's speaking to you. Now, nowadays, as you know, most of us are paperless. We have computers in our offices, or even if we are going to the OR, we have computers or tablets in front of us for signature signing, etc., for consent signing. So the human touch, the basic human touch, the first thing is the eye contact and a smile or an empathetic facial appearance. So show interest in what the other person is saying. So I was talking to my son the other day, and we were just having a conversation when I was on the telephone. And he said, "Are you listening to what I'm telling you?" And I'm like, yeah, I am listening. And then I repeated what he had said. He said, it's surprising that you're on the phone, but you're listening as well. But it would be better if you put your phone down and listen to me, what I'm telling you. So on a day-to-day basis, also, people are intelligent around you. You need to listen to them. You need to listen to their needs. Lean towards the person speaking to you. Now, as a doctor, you're sitting in your office and you are sitting back or anything. Like if somebody is trying to give you an important information about their life, they have taken time to take your appointment, to come to your clinic, face bad traffic, etc. Maybe once or twice you had to cancel them because you were busy and they're coming to you a second time. So imagine what's going on in their head. You need to empathize with that situation. So you leaning back casually and having a glance at your phone every now and again might not be a very professional and empathetic way of dealing with a day-to-day conversation with your patient. So follow the other person's topic. Use the other person's words while responding. So that is the art of communication, that within that 2.5 to 3 minutes, you not only listen to them, take a history, jot it down, but you also have a plan of action in your head. And when you complete your interview with the patient, you already have a plan of action by actually engaging the patient. The non-engagement of the patient, okay, you need a surgery and you do this, and go there and take this medicine. This is no longer acceptable. It is a consumer-oriented medicine now, and you need to be on top of your game. So the two goals of active listening are: what is the core message that the patient is conveying, and what are the core feelings that the patient are experiencing. So 4 attitudes which support the active listening. It is to listen to the whole message and being non-judgmental. So remember, as doctors, we can become authoritative. And as soon as a patient comes to your clinic, say for instance, it is a Monday morning and a lady is coming to you saying that she has a bit of a backache, and in your head, because you know when you open her file, you know that she is a teacher, in your head, you are pretty sure that this is a Monday morning and she's coming for a sick leave. So you have already become judgmental before the patient even started her conversation. You understand that? So being understanding and supportive is the most important thing, and you learn to be non-judgmental as the time goes along. And you need to not only gain this finesse, but you need to better yourself on a day-to-day basis. Now, what are the processes and barrier to communication from A to B? Now, you can say maybe a language barrier. Somebody speaks a different language to you. Yes, language is definitely a barrier, but communication is not easy even when we share the same language, because we have different agenda in our mind, and the person whom we are communicating to has a different agenda in their mind. So it could be noisy. There could be an inappropriate medium. There could be assumptions or misconceptions. There could be emotions. There could be language differences, poor listening skills, distractions, and lack of knowledge, skill, or time or energy. So all these, I mean, if you look at them one by one, we do come across these barriers on a day-to-day basis. We go home, we reflect at bedtime what you could have done better or what you would like not to repeat again, and then you move on, and then you sort of, you know, make finesse in your practice on a day-to-day basis. Now, verbal versus non-verbal communication. Again, as we said before, your non-verbal cues are the main part of your communication, so make them better. When you are giving an exam, like an OSCE exam or a simulation-based exam, again, the verbal and the non-verbal cues are very important, because we don't want you to keep looking at the table and jotting with your pencil and playing with the paper, but we want you to face the role player, we want you to face the examiner and deliver your knowledge, whatever you have come there for. And believe you me, such candidates, you know, the examiners are very, very intelligent. They filter out such candidates very easily. Okay, so look at the body language. Now, once we finish the talk and you go home, look around you from tomorrow onwards and see what verbal cues people around you are giving you. Is somebody impatient to leave? Is somebody thinking you're not appropriate? Is somebody interested in you? Is somebody disinterested in you? Is somebody menacing? Is somebody insecure around you? Is somebody lying and not opening to you or communicating? You will get, if you start paying attention, you will get a lot of cues in the non-verbal way. People look at you, people talk to you, people show their hand gestures and face gestures, facial expressions, and so on. So I always tell the students, speak 2 languages, English and body. Also, one important thing, that when we are talking to the patient, please do not use medical jargons. Medical jargons for the patients are blah, blah, blah. What are medical jargons? These are terminologies that we as doctors use on a daily basis: ECG, CTG, LMP, EDD, OA, OI. So all these medical jargons and abbreviations, nobody is going to understand if they are not, if they are not belonging to your profession. So you can do 2 things. Either you do not use medical jargons at all while talking to the patient, or you please tell the patient, and you do tell the patient on 2 or 3 instances, at least during the 5 to 10 minutes conversation that you have, that please, if you're not understanding me, stop me and let me explain to you again. So we know that we are here for patient-centered care. We know that we have a shorter span of time. The length of appointment, you know, for a history taking for a well-seasoned doctor, I must add, it could be about 2 to 3 minutes. For young junior doctors, it could take about anywhere between 5 to 20 minutes. And as you go along, you progress along, you make a template in your head, and you know that, you know, history taking becomes a bit more easier as the time goes on. But what about empathy? Should a doctor display clinical empathy? How does it help the patient? I would say the human connection to the patient care is empathy. And I'm sure you all would agree with me. And I'm sure you all would be thinking in your head those little cases that might have happened with you where you would have empathized and the outcome was good, or where you would have not empathized due to one reason or the other and where the outcome was poor. So basically, you know, it's a miracle for us to look through each other for an instant and see this is our daily life in the hospital. A patient waiting for a new heart, a patient too shocked to comprehend treatment option, somebody whose wife's surgery went well and is going home to rest, a girl who's visiting her dad for the last time because her dad is terminally ill, a doctor who has just found that he's going to be a dad, a woman who's sitting in the waiting area whose 19-year-old son is on a life support, somebody coming to the outpatient who has been dreading the appointment because he's afraid that he has left it for too long. This is what people come into a hospital on a day-to-day basis commonly going through when you, as a messiah, are there to help them, to make a rapport with them, and tell them that you're not only there for them as a safe doctor, but you are there as a savior in terms of the fact that you empathize with what's going on around in their life. So that is very important. So, and always remember that illness has a behavior. So patient's reasoning and feeling is a part of it, how a patient feels, how a patient thinks, how a patient understands the influences, how the symptoms are perceived. That's what we have to learn. We have to increase our understanding of patient's suffering because we know, and the knowledge is there, the disease prognosis and the management is there, the understanding of suffering should be there, understanding of human behavior should be there, and helping the doctor see the full picture of the patient problem, biopsychological dimensions. So identifying the factors which affect the patient health, belief, and illness behavior is very important. Now, just a few very common clinical scenarios based on research via patient questionnaires. A 50-year-old healthy man has a low-grade fever. He may react to it by A, neglect, B, taking time off from work, C, self-medication, D, visiting his family physician. And you'll be surprised that the 20% of such patients would neglect their symptoms. As opposed to a young, healthy lady who has a high fever, she may react to it by self-medication. 75% of ladies self-medicate. So the common reason for illness denial is not easy for the patient to show her weakness. We as doctors are authoritative. We could be very intimidating. So a person to actually take time out of his or her busy schedule to come and pay you a visit, and they are paying you for that. You know, they have their expectations, and their expectations are not only that you will treat them, but you will hear them. So if you're like, okay, what problem do you have? Okay, let's do this, let's do that, and I'm sorry, I'm very busy, I'll see you later, will not help. So you need to sort out your timing, and you need to sort out your body language, and you need to sort out your empathy in such scenarios. And factors affecting illness behavior are gender, age, learned behavior. Again, you see social media in this day and age, everybody learns everything about everything from social media. Accessibility to healthcare service. Somebody might be insured, somebody is not insured, somebody is in the lower socioeconomic strata, poor insurance cover, higher insurance cover, etc. Previous experience with the doctor. If my previous experience with my doctor is good, I'll keep going to them again and again. And symptom presentation, trigger factor, and want and the need to control. Like some patients, like I am a kind of patient, I want to control everything. So, I mean, if I go to my doctor's surgery, I would like my doctor to talk to me in a way that I feel comfortable that I will still be under control. You know what I mean? So there are patients, most of the patients, educated ones, are like that. So you need to empathize and get into their shoes. So I just skipped one slide to get through the illness framework and the disease framework. This is the disease we all know about: signs, symptoms, investigation, underlying pathology, differential diagnosis. But the illness framework, we need to understand what are the ideas of the patient, what are the concerns of the patient, what are the effects of the problem, what are the expectations, what are the feelings and the thoughts of the patient. So all these have to be compounded with the actual disease framework, and that is where you become a better doctor. So read the following patient scenario if you guys want to just answer me through the chat. That Mrs. Salma is a 28-year-old divorcee living with her 5 children, working as a teacher. Over the last 12 months, she has had intermittent episodes of soreness and stiffness in her knees. Now, if you are Salma, what are your possible ideas? What are your possible concerns? What are your expectations? What is the possible effect of the problem? So that is the way we would like you to start thinking in terms of betterment. So the possible ideas could be, she may think it could be rheumatoid arthritis, and it could be bad eye or black magic. It could be infection or exhaustion. But her concerns would be her children or her work, maybe. She might be worried of losing the custody of her children or losing her work. And she might be worried of losing her chance of having another husband. And her main concern could be her image as a distinguished teacher. So all these things, are they directly related to the disease? No. But are they related to the patient rapport, to the empathy, to the complete package of care? Absolutely, yes. So the possible effect of the problem is that the problem may affect her performance at work or at home, her social activity, her social confidence, her sleep, her general well-being. Look at that, look at that. Probably inside our heads, inside our hearts, we all knew the answer. But are we able to put the answer on the table for that 10 minutes of conversation that takes place between you and the patient? That's the question you need to ask yourself today. Okay, so the angry and the upset patient, how to deal with the difficult patient, how to de-escalate the situation. When we are in our clinic, sometimes the patients are so vocal and so loud, you can hear them outside. So you actually get out of your seat, you come out of the room and you try to de-escalate the situation. De-escalation means how to defuse the situation. So again, there is a method to it. There's a science to it. The art of de-escalation is the actual science, that you listen, you be aware, you stay calm. One person is unapologetically unreasonable, but you do not get into those kind of shoes. You offer them a plan. You ask for help if they are getting physical. You document in the end what happened, and then you reflect. So that is very important, how to de-escalate the situation in the hospital. All good hospitals have a code purple for which is escalated in case of any grievous harm by patient relatives or by the patient themselves, where there's a code purple team who would come and help you, which includes security officers, etc. But before all that escalates and goes to a code purple, there are quite a few things that we can do to defuse the situation. So the 10 tips of de-escalation, I always use this as a prop card for my students, that respect personal space, stay calm, establish verbal contact. Are you okay? You seem upset. And he would either say, of course I am upset, you can see, or they will say, I'm not angry, but I'm upset, So establish a verbal contact. No, I understand. How can I help you? I am sorry that you are upset. So you might not be sorry because you have done something wrong, but getting under their skin by saying the apology, it means a lot. So keep it short and simple. Identify the wants and feeling, listen closely, agree or agree to disagree, set clear boundaries, offer choices, and then debrief. So this is a very comprehensive way of de-escalation. I've got quite a few websites that I will share at the end of the talk, so that you guys can do some homework, seeing those videos and practicing de-escalation of an angry patient. So another good thing in communication, that the most important thing is breaking bad news. All of us, irrespective of our field of work, will come through breaking bad news on a daily basis, or on a weekly basis, or on a monthly basis. And breaking bad news means you're either giving them bad news about their disease prognosis, or you're giving them bad news about any result, etc. It is stressful. It is stressful for you also. But it is both ethical, it is both legal, and it is both clinical perspectives to it. So bad news may be defined as an information which adversely and seriously affects an individual view for his or her future. for some people, a small news may be a bad news. Somebody comes to my clinic and I tell them that they have polycystic ovaries, may react or overreact in a more fiercer way than somebody, as opposed to somebody who I say that you may have cancer of the womb. So I'm giving you examples of gynecology because I'm a gynecologist. So there's a spikes protocol for breaking a bad news. Practice it with your fellow colleagues, practice it at home, and make this art your daily routine. So setting of the interview, S is for setting of the interview. It should always be a quiet room, closed room, 2 chairs, 3 chairs for a family member, a table in between, and no distractions. So you should not be carrying a pager. You should not be, going or rushing for your time to some other procedure or anything. And then you assess the situation. May I know what you know already about your disease? And invite to share the knowledge. Okay, you came here for your surgery last week, and today we are here to give you the result of the surgery. And then you share your knowledge. So do not beat about the bush. This is legal, there's legal litigation. There are some relatives who may push you not to tell the patient, but your legal litigious right of the patient is there also. So you need to be factual and you need to be truthful with your patient. So I am sorry to inform you that this is your diagnosis. And then you pause. You give time for the person to absorb the news. And you give time if there is any crying involved, or if there is any over emotional scene involved, make sure you have a tissue paper handy. You have your serviettes handy. You have a glass of water handy. So always before you seat such patient, you may confirm, are you sure you want to be alone, or have you been here with somebody else? You want them to accompany with you when we talk about your results. That's very important to set up the scene. And then the emotions have to be addressed with empathy. Like, I mean, if there is a real bad news, there will be a lot of crying, and no matter what you say, they're not going to hear you. So what you do is simply a pat on the hand or a pat on the shoulder would do, and say, I'll give you time to compose yourself. Or you just do nothing, quietly offer a serviette or a tissue. So emotions should be addressed with empathy. And summarize and categorize. I normally, if I'm breaking a bad news, in the end, I tell them there's absolutely no need to take decisions today. Go home and come back at a later date. Tomorrow I'm here, or give them an open appointment, so on and so forth. And we can discuss what needs to be done. But before you go, we may need to do some test or etc., depending on the situation of what kind of breaking news you're breaking to them. So again, do not jump on them after breaking the news for the management plan, because as I said, whatever you say, the patient hears only 30% under normal circumstances. Now that you have broken a bad news, they might not be able to hear even 5% of it. So you have to give them time. Sometimes if there's a lot of crying between the family members, you may need to quietly leave for a couple of minutes and then come back again. That gives them time to compose themselves. So non-verbal cues are very important when you're breaking a bad news. Patient and family education, I cannot emphasize more how important is patient and family education, that you not only are educating the patient, but also the family. They should be participating and engaged in all processes. Every good hospital has a patient and family education leaflet given to the patient on the time of admission and modified as their journey progresses within the hospital. So their medication administration, reconciliation, hand hygiene, information, gauging the understanding of the family, informed consent, documentation and verification of that in your own notes. These are all very important. Why? A, it is legal. If a litigation arises tomorrow and if you have not documented, it means it did not happen. No matter what you say in the court of law that I did this, if you did not document that, it means it did not happen. So it's very important for your own safety, legal safety as well, that whatever happens between you, patient, and the family has to be documented. So what about, okay, we have been talking about patient and family and interaction, breaking bad news. What about inter-colleague communication? Now you come on a daily basis and, I am hearing a lot of ruckus between the on-call doctors coming, on-call doctors going, having problem with the duty rosters, having problem with who will do what on the day of duty in the ward, etc. These are very common things. And if something arises, if a critical incident or an incident report arises out of these problems, then what happens? You start blame shifting. I was busy. I was on a break. I was not posted in that ward that day. I was just called for that work. I was not the one who assessed the patient, or I just came on duty, or I prescribed the medicine, but I have not assessed the patient because the previous shift person had already done the examination. Or I have examined room 2, but I cannot remember her name. All right, so these are, I'm sure all of you have gone through this. And those of you who are students, those of you who are junior doctors, those of you who are senior doctors, we have all been there. So these are some things which create a bad rapport, a bad taste, and disinterest between the colleagues at work as well. And such teams will have difficulty in propagating and difficulty in moving ahead. And the poor communication lands us into trouble very often. Your patient may complain against you, your colleague may do an incident report against you, there could be a critical incident reporting against you, there could be serious untoward incidents by your hand, or there could be, at worst, a professional misconduct inquiry against you. So be very careful with these. The art of communication skill should be skin to skin with the science of knowledge, and that is how you avoid all the pitfalls of legalities in your profession. So these are some common and real patient complaints, because I am also quality administrator in the hospital. So I chose some very common complaints, and these are real patient complaints that I'm sharing with you. No one seemed to care about my pain relief. I was not informed when I was having this procedure. My appointment got canceled again. The nurse told me I need these tests, but no one explained them to me. The doctor came inside for 2 minutes, but got called, and I don't know now when they will return. The doctor was taking too much time, but did not answer my questions, neither listened to me. Or the doctor was on the phone. Now we give the patients satisfaction survey at each interaction during the hospital, during the outpatient visit. And these are the complaints that we got out of those information leaflets. So we try to keep our KPIs for patient satisfaction above 90%. So that's something totally out of the jurisdiction of this talk. So it will also help you to improvise your progress. That's what I mean to tell you. So what about the communication with the staff? I cannot emphasize more on Sbar and on IPSGs. For those of you who do not know what is Sbar, please go and read about it. It is situation, background, assessment, and reassessment of a case. So if you're talking to your colleague on the phone, senior or junior, and giving them a perception about a patient, you tell them the situation that I have a 50-year-old, I'm in the ER, I have a 50-year-old person, and he's come for this, and that is the situation, and the background, this is his history, and the assessment, this is what I have assessed, and reassessment, this is what I want to do. So what is your choice for that? And also international patient safety goal. The first one of them is identify patient correctly. Second is improve effective communication. Third is improve the safety of high alert medications. Fourth is ensure correct site, correct procedure, correct patient surgery. Vis-a-vis mark the site before you shift the patient to the OR. Fifth is reduce the risk of healthcare associated infection. And sixth is to reduce the risk of patient harm resulting from fall. All good hospitals have these SBARs, have the IPSGs incorporated into the medical healthcare professional practice, and they have these regular assessment and reassessment and training and retraining to ensure what? One thing, patient safety and good communication. So lead by example, appreciate, teach on site if you know more than anybody else, but there should be more importantly, there should be no conflict in front of patient and family. Whenever there's a patient complaint for some serious untoward incident, the one common sentence that the patient write in their complaint is that nobody seemed to know and they were fighting in front of me. Nobody seemed to know what was happening and they were fighting in front of me. So the first thing is you hold on to your fort. Your workplace is your relic, your fort. So you do not badmouth about anybody, especially in front of your client vis-a-vis your patient. And that is very important. So the healthcare
Shazia, 5 minutes, please.
Yes.
Thank you.
I'm almost done. Thank you. So the healthcare pearls you're going to take today are promoting excellence and reflective learning by simulation. So this is a blended approach to debriefing. Please remember that. And get the bad experience out of the way early. A customer service science tells us to save the best for the last and get the unpleasant side of the business out very early. So an overall positive aspect of your service will be when you are freeing your patient from the bad experiences. And why patient satisfaction is important, we talked about 95% of your patient will come back to you if the patient complaint is resolved. The average business spends 6 times more to attract new customer than it does to retain existing customer. But once dissatisfied patient will tell at least 9 other people, and you know the calculative science after that. Then. So what should we do? We should make the experience safe, predictable, ritualized, and maybe even pleasantly memorizable. So I have a few patients who I may have seen as their gynecologist, but they come to me as their GP now because they say they don't want to go anywhere else. So take that in your stride. So think about hotel hospitality. So this is something new that is coming into medical sciences, that the hospitals are hiring CEOs who belong to hotel hospitality business. So as a customer, what is your preference? What do you think you are there for? What do you expect? What was your previous experience? And what is most important to them is the patient experience. You cannot rise, you cannot shine unless you ensure a good patient experience by practicing listening, by practicing empathy, safety, and compassion. So we are the patient experience. So if you make a mistake, please recover immediately and follow with some positivity in your life. Take responsibility and learn to apologize. I am sorry to say, but a lot of us take their time in apologizing and blame shift. This should not be happening. Be 100% consistent and predictable and end with a wow. So again, getting with the green model, which we saw in the first slide, establish the relationship, close and maintain the relationship. And summing up the objectives, define and understand the communication and the communication process, list and overcome the filter barriers in a communication process, practice active listening and empathize, and tips to improve verbal and non-verbal communication, please. So on this note, you can take a picture of this slide because it has the training resources. The happymd.com has got some excellent videos. There is, I've put on the PDF of a book called Communication Skills by Saudi Medical Council. And also there's a link for all the videos for good communication, bad communication in this one. So basically, you know, this is a must-do program for healthcare workers, not only in GSMU, but all over the world. Communication skills acquiring is the ultimate triple pay. You're happy, your patients are happy, your work place becomes more acceptable and more friendlier. And because it will make those who are not necessarily effective communicators much better, so then you need to pursue this in your personal life as a clinician and as a person on whole. So you are already knowledgeable. Now you will become problem solver. And you're already successful, but we want you to be service oriented. That's the take home message. Thank you very much.
Thank you, Dr. Shazia Maqsood, for your outstanding presentation. Thank you very much.
Thank you.
Okay, moving right along, we are running a little behind, so I think we will take the question and answer sessions at the very end for you, Shazia, if you don't mind. And these are just, if you want to have questions, just put them in the chat box or email at askjasimiona@gmail.com. The next talk is going to be by Dr. Asif Saeed. Hold on one second. It's and Dr. Kashif Ahmad talk is titled The Impact of Scholarly Work on Student and Resident Portfolio. It's a privilege to welcome both of them. Dr. Asif Saeed is the managing editor for Medscape and WebMD, whereas Kashif Ahmad is the associate dean for the Ross Medical School. I will ask them to start sharing their slides and go ahead with the talk, 30-minute talk. Thank you.
Well, thank you so much, Dr. Safdar, for introducing us. Can you all hear me well?
Yes.
Okay. So I have my colleague and my friend here, Dr. Asif Sayed. So we will be taking turns when we are presenting. But first, we would like to thank the leadership, all the JSU Miana leadership, for bringing us on board and giving us the opportunity to present. I also wanted to congratulate Dr. Tariq Rafi and Dr. Irfan Salaman for their Lifetime Achievement Award. It's a great pleasure and honor to see colleagues who have inspired us or professors who have inspired us to, in our journey. So I'll share my slides. I hope you can see my slides now.
Yes, we can.
Okay. So I wanted to talk a little bit about the impact of scholarly work and on medical student and resident portfolio. I personally feel myself is that when you think about scholarly work, it's a broader term than research, and the term research and scholarly work can get mixed up at times. So I'll talk a little bit about my personal journey as well, and also give you some instances and some examples of how I've used students in terms of like leveraging them to another level, enhancing their talents. So I want to move forward and share a very emotional picture. This is our 1995. I can see Dr. Suleiman smiling, and that these were the days when we were in SMC, and we started in 1990. I just wanted to share a little story. At that time, open merit was announced by the Supreme Court, so there was no quota system anymore. So it was a great decision. Reflecting back now, I see that I feel that some people were emotional and were upset about it, but I personally felt that it was a great decision because it kind of brings more talent to the college. And we used to do scholarship all the time. We used to participate. I remember the student blood transfusion unit. Dr. Sulaiman, you probably are aware that you were leading some of those missions at college. So we did that. We did the student drug bank. So we were involved in some kind of scholarship and some kind of engagement, community engagement, which now in the U.S. it's a big topic. Like lots of medical schools are moving towards that model of competency and achieving that competency. So we celebrate our 25 years. This is our silver jubilee year. Unfortunately, we could not meet because of COVID-19. And I just wanted to talk about my journey is that I've always been in medical education throughout my life. I was very passionate about medical education. And I describe myself as a lifelong learner. And loving teaching and research, and also looking at how I can help other students in enhancing their talents, right? So personally, when I look at my journey, I did a lot of scholarship throughout my years. I was founding faculty for the Jinnah Medical and Dental College in Karachi. And then when I came to the US, I was part of many different programs. Well, one thing that I really enjoyed was being the founding teaching professor for Carl, Illinois College of Medicine. And this is the brand new medical school. It's the first engineering-based medical school in the world. So it kind of concept of having physician innovators, physicians who will become innovators. And I wanted to congratulate Dr. Shazia Masood for an excellent talk because, we're talking about machine learning and machine and artificial intelligence, but at the same time, we're thinking about whether doctors have humanistic approach or not, right? Whether they have empathy, whether they have, these other qualities that we need in a physician. Right now, my present appointment is an associate dean in the academic learning at Ross University School of Medicine. No, I have not moved to Barbados. I am still in the US because the operations of the university are in the US. So this is an excellent news, right? There's a shortage of healthcare professionals in USA. There's a shortage of healthcare physicians, in USA. We're looking at about like 35 to 54. I don't have the accurate numbers, but you're looking at physician shortage by 2032 in like 50,000, 60,000 range. And also in specialties like internal medicine and some other specialties. So there's opportunities for students And one thing that is happening is there are a lot of changes that is happening in medical education right now. One of them is the step 1 exam going to pass fail in January 2022, I believe, and that has been set. COVID-19. COVID-19 has hit us everybody this year. The impact on medical school applications, things have been delayed in the US, residency applications, all the processes are behind because of this, the impact. So again, we have to show compassion. We have to show some understanding of how the bodies are working very hard. And Dr. Bernie, you are there, and probably in UK as well, right? There, the infrastructure must have been impacted in terms of workflow. So this everywhere, there's this impact of the disease. And, may Allah subhanahu wa ta'ala help us and give us protection against this deadly disease, but also at the same time, congratulate our fighting physicians on the front line. So when you look at a application, a residency application, in particular in the US, you're looking at the fact that you have your USMLE scores, which are your step 1, step 2 scores, and your step 2 CK scores. Then you have your clinical skills that are accounted for. You also have your research, and that's something that I want to talk about. I would not talk about research methodology because Dr. Bernie will talk about that. And then we also look at medical student performance evaluation. We call those MSPEs. And then some other experiences such as community work, volunteer work, shadowing. Most people in Pakistani medical schools, are encouraging that. So medical students from the Indian subcontinent or from Pakistan or from international medical graduates, IMGs as we call them. So how do you enhance your portfolio, not just from a student perspective, but also from a resident perspective, right? What more can you do to build your portfolio? So you can look at participation in community work, volunteer work, or shadowing, but also looking at other experiences. I think the hobbies and extracurricular activities are least looked in an application. They could, if you are playing some competitive sports and things like that, they would probably look at those, but I think they're more looking for some other experiences, like in terms of community, volunteer, shadowing. So research versus scholarship. I want you to think about the word scholarship. Right? When we use the word scholarship, what comes to our mind? It's like maybe some monetary money or benefit, right? And I think in the US, it's like we have not really done a good job in explaining scholarship or scholarly work. And it's where my bias is that sometimes, we are part of the American Association of Medical Colleges, AAMC. And then there is, I think, the AMEE. So Dr. Bundy, you can, put a feather on your cap here, because I think the AMEE has done a much better job in terms of educational research, social sciences. I think there is also going in the US as well, but I think overall, if you look at the impact, right, and the talks. I can see there's much more dialogue there. I think that in the US, sometimes you tend to work in silos along those lines. I just wanted to share something that I feel that when students and residents are coming to me or talking to me about what can I do? How do I improve my scholarship? What do I do in terms of publications? A majority of the students are thinking about research papers. And I was very pleased to hear today from Dr. Nazir saying that, alluding to the fact that there is an institutional review board, which is great. There is a publication from Jinnah Sindh Medical University, which is a very great way of actually having our students publish in local journals as well as paving way for them in terms of offering them scholarship in terms of money. And he pointed out to the fact that there's a syndicate, right, which actually gives money. So that's great because you're supporting scholarship in terms of monetary benefit. So I just wanted to share a few thoughts here that if you look at whole scale research, yes, you have to do the methodology and you have to think of a conceptual framework, right? And you have to think about, funding, but you can also look at something that is known as a concept paper, which is much easier to write, right? You can write a short proposal, and you could write a letter to an editor, right, about explaining about some of the recent experiences. I just wanted to, ask Dr. Burney, who is here. Dr. Burney, do you think that concept papers are easier to write and short communication are easier to write as compared to big research papers?
It's an interesting question. I think it really comes down to the individual at times. I think some people are very apt at writing short concept papers, but some are more trained towards writing a slightly longer version of research papers. It's just the training behind it. It's also are you comfortable writing a concept paper, because it sounds easier, shorter, quicker, but actually sometimes it's much tougher to write a concept paper.
And that's, thank you so much for answering that question. And I think that's where the previous speaker and probably the other speakers will talk to collaboration, right? That's the key word, right? You need a good mentor. You need a good collaborator to explain to you. So if you do the thought or planning before starting the concept paper, then you can, it's a win-win situation. And then case reports, you can see the fact that there is the process of writing case reports, patient case reports, which are also interesting to write, but also serve as a part of scholarly work. And you can also write short communication papers. Now, where do you find all these? Where do you find the summary for all these? I would encourage you to look at the AMEE communication number 43. This is, if you type that, you should be able to find the common scholarly products in health sciences, education, journal articles, um, book chapters, monographs, essays are a great piece, actually serve value when you're applying for residencies. um, Editorial statement of opinion, educational case report, and that's where Dr. Nazir was talking about some of the social sciences aspect, writing a conference report. That's something that's very interesting, that you could always write a short report. Reports about teaching practices, something that you observed in the clinic or something that you observed in innovation in terms of scholarly application, is like using videos to teach. Um, and other publication formats such as videos are also counted as scholarly products. And we are not very familiar with those, right? As being counted as scholarly work, right? Like if you record a video or you made a lesson out of a video, that still counts as a scholarly product, right? Simulation, right? It's a big topic these days. Low fidelity and high fidelity simulation, that's also counted as a scholarly product. So there are many of these examples. So if you take a look at this AMEE 43 communication, you should be able to find some of those instances. So I wanted to share a little story about my student Zachariah Adam, which is who is actually getting a residency right now. And he saw me teaching. I was teaching pathology, and he told me, Dr. Ahmad, why don't we, or my name is Ahmed, but they pronounce Ahmad here sometimes. So he was like, Dr. Ahmad, why don't we kind of publish this paper on your teaching about using videos for first year medical school physiology student? And that's motivational, right? You have a student who is motivated. So I just like, well, that's great. I mean, and I was kind of surprised that he had already written the concept framework for the paper. So this paper was published in Medical Science Educator. I encourage you to look at journals that don't charge very hefty fees or money in terms of publications. You can still get them published, and they don't have any charges towards and you're trying to publish the scholarly work. So basically we looked at trends, like how students perceive digital algorithms, right, in terms of understanding through videos and physiology. And so you can read the paper. I will not spend too much time on this, on describing the paper. One of our recent papers with one of the teaching faculty was looking at how COVID-19 transformed problem-based learning at Carl Illinois College of Medicine. So this is a very short communication paper. The paper is like 2 pages maybe, or at the most 3 pages. And so then you're looking at some of these instances where you want to ensure that you can publish something quickly at the same time, having this ability to ensure that you you get some leverage out of by publishing in a good journal, such as the Medical Science Educator. And this is from the International Association of Medical Science Educators. They have this series where they allow you to publish certain short communication papers like this one. This is another example of scholarly product or scholarly work. This student who is actually in their clinical rotation actually was instrumental in actually forming the whole collaboration by herself. She's at Ross University School of Medicine, and what she did was she wrote a case report on a rare cause of tumor marker elevation, peritoneal tuberculosis. Great topic, published in Case Reports in Women's Health. So she collaborated and she worked with her resident, she worked with her professor, making those connections, making those connections in terms of workflow, getting the approval, and it's a great product which will enhance her portfolio. There are a lot of good articles coming out from Pakistan. If you look at some of these articles, you can see that perceived stress, sources, and severity of stress among medical undergraduates in a Pakistani medical school, where I think the abstract is very nicely written, methods, results, and conclusion. And Dr. Bernie can probably talk a little bit more about research methodology when he is going to have his talk. So. Case reports. This is another example of a article that was published in the American Journal of Tropical Medicine and Hygiene, I believe. It's a case report on diagnosis of COVID-19 versus tropical disease in Pakistan. So if you look at and read this article, and you can do it at your own luxury, if you read the report, it's not a very long report. It's like 2 pages, 3 pages, a great way of collaborating with colleagues and at the same time getting work published, right, which will have an impact on your application. Because you're thinking about like your chances of getting a residency or chances of getting into a fellowship by using some of these products that I'm trying to explain. So a great job done. I think that this report contains 2 tables. I think the gist of the paper talks about maculopapular rash and tropical diseases should be at the back of your mind when you're dealing with COVID-19. I will not go into the details of the paper. So then you look at these fruits, and what are these fruits doing here? I mean, you're probably thinking that this is one of my favorite fruits, the pomegranate, obviously for religious reasons as well. But it's you think about low-hanging fruit, right? It's like, what can I do? I don't have the resources. I don't have anywhere to go. Sometimes I feel trapped. I don't have the time. What can I do in terms of making sure that that I have the opportunity to do some scholarship? Well, then you can look at some things like posters. You can design a nice poster, work with some colleagues, and think about publishing a small poster that should count towards your scholarly work. Abstracts are the best way to write. I want you to also think about participating in focus groups, because if you participate in a focus group or you were part of a group that was looking at some topic in a committee, that actually counts towards your leadership. So you're building your research as well as your leadership portfolio. So think about those opportunities, even locally and virtually, like through telehealth. That should all count. If you presented a seminar as a student or a resident, then that should also count. Then again, you need to practice your skills, your communication skills constantly to make sure that you're improving on your ability to present, and at the same time building your your portfolio. Then other community work examples are health fairs. And I use the word telehealth here, but I think it's not the correct word, but I'm talking about virtual engagement, right? Because we have COVID right now. A lot of the residency applicants are thinking, oh, I don't have the opportunity right now. Everything is closed. Well, this is actually an excellent time to think about scholarship right now. It's an excellent time to think about whether you can publish a little bit more or you can find some instances. So you should look around and find those instances if possible, as much as possible. You can do some counseling. Counseling is a great way, counseling patients, or being part of some nutritional counseling or a helpline. Right now, there are lots of helplines in COVID-19 in Europe, in the US, all internationally. You can be part of it, but you have to get active. You have to take the initiative because people are busy. They don't have the time sometimes to engage at that granular level. So find a good mentor, find some good people who can help you around. I'm a big social sciences person. I love education. My passion has always been into presenting at educational conferences. These are some examples. The International Association of Medical Science Educators is one good example that students can participate. They have an international section, I believe, where you can participate. They offer some focus groups. They offer some training. AME is another educational conference. So you're looking at those social sciences experiences, right, where you can actually publish. The American Medical Association, I believe, is the AMA, right, and also has opportunities as an international medical graduate section. They actually celebrated International Medical Graduate Week last month, I believe, and that was very surprising to see that. Okay, well, there are organizations in the U.S., in the U.K., aspiring younger students or young students to actually encourage them to participate in some of these focus groups. Dr. Safdar, I cannot see my time, but am I good with time? And you can always prompt me if I'm going over, because I cannot see my clock at all right now. So
5 more minutes, sir.
All right. So then I just wanted to quickly just say that these are the where do I start, be on the look for opportunities, collaborate and create win-win situation, and dedicate time for scholarly work, and constantly think of areas you need to improve in your application. And you should think about why is scholarship necessary, and USMLE scores are important. They're important, but they're going to USMLE is going to get pass fail the step one. So the focus might get on scholarly work. So make your clinical rotations meaningful, and probably look at some certification as possible. I want to pass to my colleague, Dr. Asif Sayed, to talk the rest of the talk. So Asif, do you want me to stop sharing?
Yes, if you don't mind, Kashif. Thank you.
Thank you, Kashif.
You're very welcome.
Just give me 1 second. Let me share my screen.
We just thank you very much. Great talk, and just running a little bit behind. We'll try to catch up by taking all the questions at the very end. Go ahead, Asif.
Do you see my screen? Let me
Yep,
just. I'm just trying to the slide show. Thank you very much, Dr. Tariq, sir, Dr. Zeenat, Dr. Irfan, everybody, for inviting us. This is obviously a great opportunity for me. Kashif, again, we are class fellows, been together for 30 years. And again, looking forward to working with future sort of leadership with GSMU. And again, whatever we can do as alumni, as sort of part of your team, we are happy to do it. In terms of little background, I'm from 1995 class of Sindh Medical College. I don't know why I still say SMC, but GSMU, and graduated in 95, moved to UK in 1996, right after the the house job. Never intended, never wanted to be in the US, but uh, started working at, I think Dr. Bernie knows in Dudley or Dudley in 97, general medicine, pulmonary or respiratory sort of medicine. Then looked around and got into NHS Information Authority, which was a business kind of information business unit for the NHS in England. Got into as a secondment for a year. Wanted to go back to practice a year later, but in 1999, 2000, they transferred me to Chicago for a project. And 20 years later, almost 20 years later, is still here. And been working on sort of on the management side for 20 years now. And my recent gig, as Dr. Zenith mentioned, I'm working as the managing editor and clinical manager for WebMD and Medscape in New York, based in Chicago. Uh, uh, the the part I took when Kashif and I started sort of working on this and on this research symposium, we picked up like two very different sort of aspects of research. One was on the scholarly sort of work side, which Kashi presented, and I picked up a very small component, research in medicine. I don't want to dwell into the items which Dr. Bernie is going to take over in the methodologies and stuff, but when I started, I mean, when I graduated and moved to UK, I had no idea what is research, what I need to do, and I moved to again to the hospital, started as a clinical techie, and when I was working with my consultant, he asked me, I mean, about the research experience and stuff, and I was like, huh, what are you talking about here? I have no sense, no idea. The only sort of rotation booklet I had was made up by the Jinnah hospital guy. I mean, been to a few wards, but that was it. No research, no nothing. So my first experience essentially was basically in an immunology department in the hospital I was working, a very small sort of aspect, and that sort of broadened my understanding of what will research do for my future. I mean, at that point, I mean, I was still sort of working on my MRCP sort of part of it, and you can expect, I mean, all the issues coming from Pakistan, having no established base and whatnot. Anyway, so I started in the immunology side of things, on the research sort of side. Then I started learning on the sort of areas where it's research is not just clinical research, is sort of first thing I learned. Then as I moved into sort of my career back in NHS, when I moved from the clinical practice to the administrative or sort of the IT part of it, I learned like all of the stuff I was taught mattered, but the part which was missing for related to research is like, again, clinic medicine is not just clinical medicine looking at the patients, and all the research, everything related to research could be focused on every aspect of medicine. It doesn't have to be clinical. And the reason I drafted this slide is that this is what I've been doing for 20 years. I mean, every single aspect, public health, pharmaceutical. We have, I mean, Kashif and I have been talking to one of our class fellows. He's the leading research scientist in UK right now, running a patient safety business for pharmaceuticals in UK, Cheshire. Public health. I've been involved in public health research, teaching students on the health data visualization and surveillance. Never heard of sort of topic when I was a student. Basic health sciences. Kashif is an extremely good example of where he started, and again, teaching and doing all this research, not just on the education side, but on the health sciences side too. Clinical sciences, as you all know, I mean, again, one aspect of the focus you can concentrate. Informatics is what my specialty is. I've been involved on the informatics side, EMR development, revenue cycle management. I directed a department at the American Medical Association where the only thing we all talked about is, again, people understand ICD-9, ICD-10, CPT. I directed the whole revenue cycle management for them, the policy for the whole country, for the US. you're talking about $800 billion worth of industry, and all sort of thing revolves around informatics. A lot of research happens there. Then health policy administration and management, and then healthcare research administration and management. Different aspects of similar sort of thing. One is very focused on the research management, clinical administrators, CRAs, those kind of things. Policy is on the policy side of business or policy making at the very highest level for the country, for the states, as we call it in the US. I mean, we have starting from for the federal government all the way down to the states and the counties and whatnot. Everywhere there's a need for research, for health policies, how to spend money, where to spend money. A little thing, I mean, in the current schema of things, this COVID-19 vaccine, the the policy started at this federal level. They're giving it to the states, and now the states are making sure like everybody gets it, like whoever is in the required sort of area, physicians and senior sort of patients, nursing home patients. So again, that's exactly similar thing happening in the UK. So again, that's the policy. You're not seeing patients, but you have to do your research. I mean, look around a lot of things where your policy will impact the most the community, how to administer that, how to manage all that stuff. uh, so this is more on sort of the front, what you probably will know or know, like what happens and what are the focus areas. I want to give another sort of look at the research. And again, this is what my new learning was when I started dwelling out from clinical practice to the business side of medicine, or you can research in every aspect of these sort of different areas. I work with sort of the company revenue I have to generate. Most of my work is related to research and analysis or analytics of clinical data. Communication, I have to communicate, I have to do research in terms of the best way to communicate for my clients so that they can communicate to their customer base. All that includes research, clinical development, entrepreneur, innovation and investigation, administrative. I've been doing this for 20 years, never heard of when I was graduating. All those things, policy and strategy, legislative and regulatory. I sit on the committee at the Department of Health level, where they regulate a lot of this medical record reimbursement policies, where, and again, people in the US at least understands how to submit uh, uh, for your reimbursement. What is the process, the forms, the 500 and 1400, all those kind of forms, all those sort of are based on research in the clinical market or the healthcare market, how people will react, how physicians will get paid, how much they can afford and how much cuts. All those things are based on research in within the healthcare regulatory sort of space. And then academics, again, you can do a lot of activities within the academics. All those things were never heard of when I was graduating, and now I've been dealing with everything. All of these different boxes can be sort of related to some type of research, and every single area can be a professional career for any of your students. uh, Next slide is very basic stuff I'm going to go through quickly in the next few slides. Again, Dr. Burney will get into the methodologies and stuff, but I just want to give a sort of a flavor of what type of uh, researches are there. It could be a primary one or a secondary one. So primary is basically conducting studies and collecting raw data, laboratorial, clinical, epidemiological, etc. Or the secondary one, where you evaluate and synthesize data collected during the primary research. I'm not going to describe too much on sort of on this. I really like this slide, which sort of gives you exactly the sort of the components or the areas what you can focus on or look around and work on. Basic research, clinical, again, public health related, community based, or secondary. You can pick and choose any aspect of this and can make a career out of it. And again, study that everybody knows right now on the clinical study, all this COVID-19 vaccine researches are happening. uh, the research was, again, out of sort of interest, this COVID-19 vaccine research happened 15 years ago for Zika vaccine, which is again evolved into what we see now, all these COVID-19 vaccines. But again, the research goes on, and a lot of impact obviously happening right now on those sort of things. So the next one, so research can be funded or unfunded. When I again started looking into this perspective of research, I always thought, like, I mean, you have to have funding in order to conduct research. Yes, sort of fundamental is like you have to have some sort of funding, but a lot of time, I mean, you can get hooked on to somebody's sort of already sort of established sort of research. You don't have to be funded in order to conduct research. In Pakistan, I mean, obviously there's a little more flexibility in terms of getting on a research sort of grant or a research project. And again, you can get, like what the research I did on immunological sort of reflection back in UK was not funded, but it was just a hospital-based initiative which was done by the consultant at that time. So again, don't have to always worry about funding. I mean, you can still get on unfunded sort of aspects of research. Just out of sort of interest, the majority of funding for research in medicine comes from either US or Europe, and the rest covers only 20%. So the focus, again, if you're looking to some sort of career building on the research side, probably US or Europe would be the best bet in terms of the options. That's where the money is. And again, I'll next couple of slides, I'll get into like sort of the research in the US and the research in the UK. Again, types of funding related to my earlier slide: research project grants, research center grants, career and development grants, institutional grants, assistantships. I mean, last three probably would benefit you more than the other ones, but still, one thing I would like to mention is university-based medical programs, research fellowship programs. You can get on. Lot of time you don't even need like licenses to get onto these fellowships. I mean, they can bring you in, you can do the research and go back to your home country. I know folks, I've been sort of working with these kind of folks where they get in, do the fellowship for a year for a particular topic or subject and go back home. I mean, in a clinical setting. So a lot of opportunities in there where you can sort of work around into that. Couple of more slides. Medical research in the US, normally federal government sort of funds it with its NIH is the largest institute. Even at my level, which I'm obviously I'm very low on the totem pole of it, but I brought a couple of researchers back to Pakistan on NIH side last year, and I failed to actually convince anybody to be a part of that for some reasons which I'm still trying to understand. A lot of development happening on sort of these diseases like malaria and stuff, and there was a big project which they wanted us to be a part of it, but again, I was not able to find any partner in Pakistan to do sort of that. In the US, again, department like DOD, Department of Defense, Veteran Affairs, Military Health Service, lot of funding on all varieties of research. State and local governments, industry obviously is always sort of jumps into all these type of researches. Foundations like Bill Gates Foundations or medical research organizations like Leukemia Foundation and Diabetes Foundations and all those kind of things. Organizations support some type of research and fund it. Disease focus, and obviously universities and colleges. The opportunities are immense, and again, you need to find those opportunities, but any of those governments, and a lot of grants are for third world countries and again countries with low sort of low economic status. So again, if you can find something, you will definitely get involved into that. I would sorry, my next slide. One second. UK, pretty similar system, private sector, public sector. And again, don't want to get into too much detail. A lot of research I did, or back in UK was related to National Health Service, and my focus was obviously on the data side of things, and primary care research I did with NHS, the data transactions within NHS at that time, and again, lot of opportunities there. It's a matter of finding one, and again, comes from private sector, industry, or public sector. And again, and I'll provide some resources in my last slide, which again you can go and look and try to sort of make a sense of it. So how to be successful? This is actually dwells into or gets to the same point Dr. Shadia and Kashif said. My personal, the way I did it, I mean, sort of in business 20 plus years now, I mean, you have to research about the research. I mean, what you want to do and what is your goal. Sometimes you don't need a goal, but you still need to figure out, I mean, how do you want to sort of take the first step? How would you communicate? Again, not from the clinical perspective, but from sort of how would you communicate to the person or the group or the company or the industry you're going to talk about? How would you interact with them? You have to ask them questions. Every single person will respond. I mean, my understanding when I started that, like, again, I still lived at that in 95, was like my consultant was sir. And he told me, I'm not your sir. Sirs are on the lordship side. And again, I'm Dr. blah, blah, blah. So again, you have to ask them. I mean, you have to stay like at that communication level where you ask what you want and how do you want it, and try to make a sense of what response you get. You need to focus on it. My personal, and again, what I've been doing, when I was a student, I had no idea about health informatics, medical records, and the business side of health. When I picked up 20 years later, I still sort of practice the same old thing, which I've been doing for 20 years. Never really had any idea when I started, but again, look for unique niche areas or topics. A lot of emphasis in developed world is on researches on like things which are happening within the sort of the lower economic strata countries or regions. A lot of funding, lot of opportunity. It's a matter of how you will find that. Persistence, again, if you fail on one side, look for some other opportunity. You will find work. And again, there's no replacement of hard work. All these things, I mean, these are the example of what I did. And again, at this point, again, I think I've done pretty okay in terms of learning a lot of sort of things which wouldn't have been possible hadn't I done all these sort of steps. Critical success factors, again, based on the previous slide. Critical thinking, whatever level I mean you can think about. And again, no thinking is bad thinking. I mean, you have to sort of slice and dice the information and think. And again, you need to have good communication skills. And communication skills, one of the key things which Dr. Shadia said is listening skills. And I learned it the hard way that it's not always the verbal communication, talking, but more listening, especially on the business side of things, whether you have patient in front of you or whether you have the management or you have the clients or whatever. And the last item I always like to say, like problem solving. As a manager, I don't want my staff to bring problems to me. I want solutions for them. Again, you have to bring solutions to a problem, and it doesn't have to be complicated. That would make your life very easy. Like, bring solutions to your whomever you're working with, whether it's a consultant, clinical, business side of things. Try to come up with ideas which will solve some type of problem in your research. In my last slide, I have some resources. Again, I can have many slides, but these are sort of some of the basic things which I work with the students in the US. I had some students came from Pakistan, and again, I got them into NIH for some researches and stuff. Everybody will respond to you. Every organization in some shape or form will communicate with you if you're interested and start working with them or communicating with them. Whether it's clinical trials, grants, a lot of opportunities. And And again, it's just a matter of finding what you want to do and how to do it. Research Center in the US, MRC in the UK, I work with them, NIH in Australia, New Zealand, and again, CDC for current what is happening in the COVID sort of pandemic arena. CDC is one of the largest sort of funders of research for COVID, and not necessarily for the US, but the whole sort of whole world. So again, I will stop at this point, and I hope I'm on time, Dr. Zeenat, and anybody can reach out to me. I'm happy to answer now or later. Like again, they can email me. I'm happy to sort of link them, students, to different entities, however I can help with. But this is real world sort of experience which Kashif and I bring, like my other sort of friends. So again, there's an opportunity for all of us. It's just a matter of like doing it and moving on.
Thank you so much,
Thank
Asif.
you. I will stop.
Thank you so much, Asif, for a great talk. I think all of us appreciated that informational talk that you gave. And I'm going to next ask Dr. Amir Barni to give us an insight on Introduction to Research Methodology. Dr. Amir is a senior lecturer. He's the academic lead for clinical skills. He's the director, co-director of the studies, clinical studies and clinical trials, phase 2 and A and 2B at the University of Sheffield. So I'm going to ask him to start sharing his slides with us, and then you have about 30 minutes. Go ahead.
Thank you very much, Zeenat. I hope you can see my screen and slides.
Yes, yes, we can. Thank you.
Thank you very much. Let's go back. So, Bismillah ar-Rahman ar-Rahim. Assalamu alaikum again to everybody and to all of my colleagues. Some really interesting talks, I must say, to Asif and Kashif. They're really giving me some really good food for thought and also guiding students. I think that is the ultimate aim here, is to help junior doctors and the medical students as well as to what we think is the research is all about. And as Asif rightly said, we had some idea when we were doing our work in Pakistan, but not to the extent we should have had, I suppose. But you know, we are here to learn from each other and share resources. So we are living in a different time now. So thank you again. So as you rightly said, I was given the title of the talk was the Introduction to Research Methodologies, and given 30 minutes or so. But what I was thinking that I'll gear this talk towards my colleagues, the medical students, and also the junior doctors, especially to those who may not have had much experience of research. So I will just sort of talk a little bit about myself, just to let you know that where I'm coming from. It's interesting, orthopedic surgery was mentioned earlier. I am an orthopedic surgeon by trade. I used to be one. Now I work as a full-time academic in Sheffield Medical School, University of Sheffield. Along the way, I collected some qualifications like we all have, so I won't really talk about those. But especially when we started to do masters, you have to do a lot of research work as dissertation projects and work. My work is now in senior management in medical education, but I do look after the academic foundation doctors, look after their projects and the work they do, and also as a tutor on the postgraduate certification of medical education in this country, University of Sheffield. You do come across a number of projects and the work people are doing, some really good work actually. So what I was thinking that I will give a little overview, because I have to be very mindful. I'm only talking about an introduction to the research methodologies and not really an extensive talk on research itself. And also touch about the types of researches which are out there. You will hear many, many terms, and I'm sure you already have. Talk about methodology and methods. We tend to confuse them often. They are not the same. They are different terms entirely. And also, what does it mean to do a systematic review? What is review of literature? As always, I'm always open to give advice and tips to our colleagues, and also take tips and advice from you as well. But also a recommendation to our colleagues who are involved in higher education, universities and medical schools, as to what could be done for our medical education, undergraduate medical education and students, to help them learn the research skills at an early age, maybe first year or second year even, if it's not already being done. I'm more than happy to share some resources as you go along. So a little question, a little bit of homework while we're here. So take a piece of paper, or in the chat box if you can type quick enough, what comes to your mind when you think of the term research? And this is especially geared towards my medical students listening in and the junior doctors who have not done much research, because it's a very big term. So write literally anything. There are no right or wrong answers. Yes, this is not a test. So I'll give you maybe 30 seconds or a minute to write what you think research means. And again, let's come up with some terminologies and phrases. And you will be surprised that there will be the usual suspects will come up. Research means investigation, deduction, affirmation of existing knowledge, finding new knowledge, as somebody said, primary research or secondary researches. So do think about, what does a research mean to you as you go through this talk. So if you look, we should search literature like we all do. If you look through books or look through academic information out there, you will find a lot of definitions as far as research is concerned. However, the basic information is the same. It's taking the stance on a question. You pose a question, then you start to think, all right, how do I answer that question or that hypothesis? How do I collect data? And then how do I present an answer to that question? And how do I prove whether my research is working in a positive or not direction? And again, as I said, to many of us, research may mean differently. To us, it might mean clinical research. To somebody, it might mean academic research. Or to some people, it might be social research. But really, the bottom line is the same. You are posing a question or a hypothesis, and then you're investigating based on that question you have posed to yourself or to your colleagues. But why do we research? Why is it important to you? Ask yourself that question, actually, both for medical students and also junior doctors. Why is it important to you? Is it because you find it interesting? Or do you find research stimulating? Do you like to be an investigator? Do you think, yes, this is something I like to do, as opposed to I have to do, which is slightly different, because sometimes we have to do things because they are required for career progression, or they are required for academic progression. For example, in many medical schools in the UK, they are part of a student self-selected component as an undergraduate medical course. So you have to do some sort of research projects as part of your undergraduate course. But as somebody says, as I think Asif was mentioning it earlier, there is this growing interest in research, both from institutions, from government, from public, and especially patients. They want to see how things are being learned by the medics or the doctors of the future. So there is definitely an interest coming from public and private enterprises. Impact. Clinical practice is changing all the time. This year is a big example of how things have been impacted by ongoing research and how quickly the vaccine, for example, came out. But a lot of hard work goes into that research. So clinical practice is changing all the time as a result of ongoing research. So think, are you able to make an impact to the work you want to do through your research? Some key questions, and this is again going back to basics, is to ask yourself as a medical student or as a junior doctor, what area of research am I interested in? It's a really key question, because you really want to go into an area which is of interest to you, which takes your fancy. You think you can do well in there. And often if we go into our comfort zones, which is absolutely fine, we would like to, if I was working surgery, I probably will pick up a surgical aspect, but why not do educational or social research? Why not step outside your comfort zone? Because you will learn new skills and you will learn more, and you probably will read much wider and deeper. And that does help as you become more experienced and as you start to develop expertise as a medical professional. Having read wider and deeper does help you to learn more skills. I think that is something you should be thinking of. So don't be afraid to step outside your comfort zone and stay with the medicine or surgery, because those are the two big specialties. But do think of other specialties, and also think of educational, academic, social research as well. The research question which you're going to pose in your in your thesis, your dissertation, your publication is quite an important one. It is the key question. What are we asking here? What is your hypothesis? And then once you know this is the question, then you can start defining strategies around it. You might just think, all right, what sort of strategy am I looking? People have been talking about methods and methodology earlier. And I will just touch upon a couple of words here: inductive research or deductive research. So what does that mean? So for example, excuse me, I'll take a glass of water. So inductive research methods are used to analyze, for example, an event or an observed event, for example. And deductive are used to to verify an observed event. And deductive are more likely to be quantitative focus, whereas inductive are more likely to be qualitative focus. So there is some background reading or information you might have to have at hand before you start to devise strategy. As always, with any research project, you have to then do a post-hoc analysis of the data you've collected. You have to interpret the data, then you come up with results, and then you pass on recommendations. That is the impact. Also, what are you going to do with that research? Are you thinking of publications? Are you thinking of putting into a dissertation, and so on and so forth? Are you thinking of presenting it? Or is it going to a national or international level of impact? So always think about those things as well when you start working on a project. Thinking right at the beginning might help you actually at the end. So a characteristic of any good research project would be that it has to be systematic. The approach has to be entirely systematic. It has to be followed to gather accurate data. If you can do this based on logical reasoning, and also you are involving both inductive and deductive methods, then certainly you are on the road to success. So there are now many, many types of research. I hope you can still hear me clearly. I had a slight internet drop here, but I hope you guys can hear me. So let me know if you can. So basic or applied, quantitative, qualitative, mixed methods, problem solving. You will hear these terms, you will read about these terms. But what's important that you read, you do a lot of pre-reading before you start to decide what type of research you're going to do. For example, basic research is data collected to enhance knowledge. It's a basic type of research. Applied is probably what we do. Applied research focuses on on analyzing and solving real life events or real life problems. So probably what we are very, very familiar with. Quantitative and qualitative I shall talk about. And then you can combine the two. You can talk of quantitative and qualitative in the same you can put them together and have a mixed method, which is a more robust study, this triangulation as well. So think of what is your best type of research for the question you are posing as a research question. Once you have posed a question, you have some sort of strategy. You can start thinking of what type of project am I going to do? Is it a non-lab-based project? Think of working in the community. I've talked about social care and social research, primary care, which is family medicine or GP practices, education research, meta-analyses. Or are you more interested towards doing a laboratory-based project? Some people really like to be in a lab environment and think of working in anatomy vet labs, for example, microbiology labs, physiology or pathology labs even. And maybe that is something that suits you as a learner or you as a student. Clinical skill centers and medical schools, universities are a really great resource of thinking where an academic or an educational project might be undertaken. For example, at Sheffield Medical School, we have one of the largest groups of patient health educators in the world, and they are a very rich database, and exploring their views of why they help to educate the next generation of doctors is a really interesting project, and we have done that. In fact, my own dissertation was based on working with patients as to why do they help in education, what's compelled them to come forward, and why would they like to help the doctors of the future in terms of education? How do they see medical education taking shape and form, and how can they contribute? So there are some lateral thoughts. You don't have to be, as I said, a very non-lab based or a lab based in terms of project, but you can also think of slightly wider and slightly outside your comfort zone, as I said earlier. Now, here comes another question for you guys. So again, what is your understanding of methodology, and what is a method? So I would again just say, write it down on a piece of paper or in the chat box. And again, no right or wrong answers. But I would like you to sort of explore your own current views or your understanding of what you think is methodology and what you think is method. And again, I'm focusing more on the medical students here and the junior doctors, and not my astute and experienced and expert colleagues here, because I'm sure they know all about methodologies and methods. I hope you can hear me still. Zinat, can you hear me? I'm having a slight internet drop here.
Yes, we can hear you.
That's fine, fantastic. I can see my signal slightly dropping, so I'm slightly concerned about the internet usage being Christmas. So again, it's important that you think of what methodology is and what is a method. I'll show you a little slide, just sort of going through. Here we are. So methodology is the study of methods and in reference to the strategy or your approach to research. And often what's happened as a basic, even I was guilty of making this mistake when I was writing my first project, that I started to mix the two. Method and methodology are often used as they are the same, but they are not. Because method is the specific technique, tools or set of tools you're going to use for collecting data. And it is informed by your methodology. So as you can see, methodology will include a number of strategic things or techniques or tools you want to do. For example, literature reviews, a systematic review, or what sort of data collection tool are you going to have. And then you apply one particular method to collecting it. So it's quite important that you have that very clear distinction between methodology and methods. For example, when you talk of quantitative methodology, you might want to use a questionnaire survey, or you might want to conduct an experiment and gather data from it. But when you start thinking of using a qualitative methodology, you might want to use semi-focused or semi-structured or fully structured interviews, one-on-one, for example, or observations, for example, in a focus group, or use some documentary analysis. Or sometimes you might want to combine the two, as I said, a mixed method way of working. So you might have a quantitative methodology working alongside a qualitative methodology. For example, you might collect data of how many people in a hospital exercise, for example, and then out of that, you take a smaller sample, which is usually a highlight of a qualitative method, and then go and do some interviews with those people as to what are their perceptions, beliefs, ideas about exercising, for example. So again, you can do a number of things. You can do a pure qualitative or a pure quantitative, but when you start mixing two, for example, quantitative and qualitative together, you get a slightly more robust study. The systematic review is quite an important element of any research project you do, because the aim is to produce a synthesis of the research that will answer your specific research question. And based on your research question, it will also determine the resources for your review. Are you looking to, for example, look at all peer-reviewed journals which are in relation to your question? Are you going to include published and unpublished evidence? Are you going to limit your findings or your review to randomized controlled trials? Are you going to include more study types? What specific time period are you thinking of? Are you thinking in terms of months, years, or more shorter time, for example? Think of how this pandemic, again, from March till December, how quickly the research happened and we came up with a vaccine. So sometimes you have to think of time frames as well. What specific population are you going to target in your research project, and how are you going to find information around that population as well? This is one of those things. I'm sure some of my colleagues will remember going to the library actually and looking at journals and picking out the articles and then photocopying them all through the night and then bringing them back home and then highlighting nonstop and then finding where the relevant abstracts are. But nowadays it's becoming slightly easier. But has it? I think there's an overload of information on the internet, and sometimes you get so much consumed by the information that it becomes quite difficult to start unpick those trends of information and then really target your own specific research. So for those who are novices in research, this is something you have to be very mindful of. You need to find the right online search tool. And this comes from by talking with your supervisor, your colleagues, people who have done similar researches in the past. But Google Scholar is a good one. So is PubMed and Scopus, Science Direct, for example. There are many, many out there. But I think I'm talking from personal experience here, where I've used these few. But if you work at a university or if you're studying at your medical school, I'm sure your university or medical school will have their own dedicated search engines through the library. So make use of them. In fact, the librarian is one of the best persons to ask because they will definitely give you the guidance you need sometimes to use search engines. Have you all tried Wikipedia? I think we all have. Hand on heart, we've all done that. But it doesn't matter. It is a starting tool, but you have to be very careful using unconfirmed sources or which are not properly referenced and so on. So make sure that whatever online search tool you are doing, you are using, it is coming from a confirmed research source, for example. Now, why do I talk about searching strategies, especially for junior students here? It's because the more time you put in, the more time you will actually save. And by saving time, you will actually find more relevant results in a structured manner. And by identifying your main keywords, and I'll give you a little example in a bit, and concepts of your research question, you make it slightly more easier to actually come up with the abstracts you are looking for. Always think of alternative terms, combine search terms, and I'll talk about that in a bit. And use multiple online search tools, like I just said, PubMed, Scopus, and many others are out there. But think of academic databases such as Scopus, a really good one. And there are some more, for example, there's PubMed, which I really like. Now, the search term I was looking at, I was thinking of what is the relevant search term I can use today. So I don't know if you can see this, but I wrote down healthy diet this morning, thinking it's Christmas and we are on a break and we might start eating. So if you want to do a search strategy, let's say your research project was all about healthy diets, how would you do it? What will you do in terms of identifying the keywords within that phrase, and how will you start to do a review of literature? This is something which I found very useful when working on bigger projects, is to do something what we call mind mapping. We use paper. I drew on sheets of paper or big charts, but nowadays you can use online tools such as MindMeister. Really nice one. Actually, I would recommend you have a look at the website. Given the scope of my talk, obviously I can't talk a lot more about these things, but I would certainly think that using a mind mapping tool will be very, very useful when you start to develop ideas around your search term, but then also expanding to include more search terms and also more ideas. So always think of using a mind mapping tool when you are working on your research project. Phrase searching, some of you are familiar with research and more so than I am, but phrase searching is something I learned when I was also working as a student, junior doctor in this country, and I started to, somebody told me, have you tried phrase searching? And I said, no, I haven't really, because I was coming up with thousands of abstracts with the project I was doing. And what you basically do, you look at the example I've put there, healthy diet. Now, if you put healthy diet in quotation marks, healthy diet quotation marks, you actually will see abstracts where the two words appear together. If you do not put them in quotation marks, you will get healthy and diet in abstracts which are separate, and you will end up with a number of abstracts which you may probably have to go through, but they may not be relevant to you. So it's important that you start to learn these tools as a junior doctor or as a medical student, that the moment you start using these tools, you will find that your job is becoming slightly more easier and more thorough or precise or targeted. Combine search terms. If you heard of Boolean operators such as and, or, and not, and some search engines will use not only. So use, for example, if I was to say healthy diet, then you can say healthy and nutritious, or diet and nutrition, or diet or nutrition, and then you'll see how your results will become slightly more narrower depending on how you put them, or broader based on how you or what Boolean operator you are using. So again, all search engines will have Boolean operators. If you look at Scopus, PubMed, I'm not sure about PubMed, but definitely Scopus will have those Boolean options. And it's important to make sure that your search is more precise, thorough, and then produces the most relevant search results that you're after. This is the advice I got. It's very, very important that, as I said earlier, that you pick something which as a topic is interesting to you. Sometimes you might want to go outside your comfort zone, which is absolutely fine, but always make sure that you choose a topic wisely, because there's a lot of hard work coming ahead. You could be doing a BMed Sci or a BSc or part of your undergraduate course, or you could be doing it as a part of a master's program or FCPS dissertation or other programs. So it's a lot of hard work you're going to put in, lots of hours, to make sure that you choose your topic wisely. Who is going to be a supervisor is probably one of the most important decisions you will make both ways. For the supervisor as well, taking on trainees and people they are going to mentor is quite an important question. When will you be doing a research project is also quite important. As a medical student in the UK, for example, you can intercalate and you can do an additional qualification. You can do a BSc, a BMed Sci, or a master's program while you are a medical student at a university. Or is it part of your clinical career path if you're doing a fellowship, for example, or a master's program both here or abroad? But I do say to myself as well, and I did say to lots of my colleagues who are currently doing research, is to keep on going. At times you will hit a brick wall. You are sat there, you can't write, you can't think of stuff, and you think you're getting exhausted, but don't give up. Things can go wrong, things will go wrong, but you don't give up, and be resilient. If you find something new, ask the question, and do not be afraid to learn new things. This is more a recommendation for my fellow colleagues here, those who are involved in higher education. And I was earlier listening to one of our colleagues who was talking about how well they've established research output at their university, at the Jinnah Sindh Medical University. And I think I could share an example of how very early in their career, medical students should be learning or developing research skills. So I'm thinking of first-year medical students, second-year medical students possibly, and you could develop a research module over a specified period of time, 6 weeks, for example, with the aim to help students to understand how to select a current research project, work with a team, or work with members of a research team, learn how to work in teams, for example. And then at the end of it all, they should be able to produce a report which shows that they have an understanding of how research processes work, what is qualitative and research, or what is quantitative, for example. But also equally importantly, as somebody said earlier, is also understanding the ethics, the ethical dimensions around a research project, and also how do you acquire ethics? How do you write a research proposal to get the right ethics from the ethics committee? Funding was mentioned earlier by Asif. I think funding is critical, both for organizations as well as sometimes individually, as to how will you fund your research project. To assess your student, once that have they actually learned something in this research self-selected component, they could produce a report, for example, demonstrating an understanding of basic research processes around questions, the research question, for example, methods, methodology, analyses, and interpretation of data, and what are their conclusions. But also equally importantly, they should be able to reflect. I'm just giving 500 words here, just an approximate, but this could be 500 to 1,000 words, for example. The key questions to ask themselves, the students, would be what have they learned during or experienced during the research attachment, and what learning points are they taking forward, which will shape and form their future learning. Some really good resources. I think ResearchGate for my junior colleagues is a really good one. PubMed, Scopus, they're quite well known. Academia is another one. There are many others, as Asif was pointing out, lots of resources out there, but sometimes you do feel overwhelmed. And I've found from my own personal work that I found these ones to be right at the top. So they really worked for me. They may not work for you, but do have a look. We'll also share some resources with you. Again, this is just bedside reading, but do have a look. What does a systematic review? As I said, I'm looking at the time of nearly 30 minutes now. So as you can see, in just introduction to research methodologies, we cannot cover everything in great detail, but certainly when you have the time and when you're thinking of developing a research project, do look at what systematic review means. What is a meta-analysis, for example? Monash University from Australia have a really good website. They talk about the research life cycle, and the research life cycle will talk about concept and planning of research. We'll talk about exploring and organizing your research, for example. How do you collect data? How do you analyze it? What output are you expecting from your research? Funding as well, and then the impact of your research is quite important. That how do you think your research will impact in terms of organization or even bigger nationally, for example. Coming to the end, as somebody said earlier, I think our honorable Vice Chancellor was mentioning how many people have been affected by this pandemic. I think Kashif also touched upon it. And again, we have lost many friends, colleagues across the world. And I hope Allah subhanahu wa ta'ala will bless them with the highest honor in the Jannah. Many of our friends are still quite unwell. So again, we are hoping and praying that Allah ta'ala will give them shifa kamil. But today we are celebrating two major events. Obviously, it's our founding father's birthday. So felicitations to all my Pakistani friends and colleagues across the world on his birthday. But also we are celebrating a festive period. So from Nottingham, which is where I live, from myself and from my family, I would wish you a fantastic time over the festive period. And finally, once again, I would like to thank the faculty of Janassan Medical University, the alumni both in Pakistan and GSMUANA, on behalf of Apne and myself, for your time and giving me the opportunity to talk to you. I'm more than happy to be contacted. My emails are there in the presentation. And if any student or junior doctor would like to get in touch, please do so. Or any colleagues would like to get in touch, I'm absolutely happy to be in touch with and take this discussion further. So at this point, I would like to thank you all. Thank you very much.
Thank you so much, Dr. Amir Birni. Wonderful talk, and I learned some new tools today. Great. Thank you so much. I appreciate it. And now I'm going to introduce a new presenter and the new talk. And the talk is Empowering Trainees. And the presenter is Dr. Zina Safdar. She's an associate professor of clinical medicine and director of pulmonary hypertension center and the clinical research at the Houston Methodist Hospital. And she is also a president of JSMUANA. So let's welcome to Dr. Zina Safdar. Thank you.
Thank you. Can you see my slides?
Yes.
Okay, perfect. Thank you so much for your kind introduction. And everybody talked about what how they actually came into research, and mine is not different. Also, I started my clinical training and somehow ended up in a lab doing basic science research and learning research methodology, and then going towards clinical trials. So my life is basically doing a lot of clinical studies and managing a lot of different registries and studies and mentoring students and trainees and fellows and residents. So that's what I do in my spare time. So I'm going to talk about a little bit about how can we help our students, how can we actually improve ourselves, because if we improve ourselves, only then can we help other people and help them grow, help them expand their CV and exploring different options. So basically, as physicians, this is what we do. I've borrowed these slides from different resources, but we spend some undergrad in a college, and then we go to medical school and do 5 years or 4 years of med school, then go through residency, and then post-grad training, and different specialities are here. And basically, this is what we are doing right now. We have board certifications, and as we pass each exam, we get a little increment in our education and in what we're doing, and then our life is like that. But if we, on the other hand, as Asif and Kashif mentioned, if we go the other way, we go the master's programs, or we do MBA or MHA, a little difference in it's more of a gradual increase with relocation and promotions. So how can we combine these, and how can we find out the best way that we can improve ourselves, and what is our personality fit in? I think everybody, when I was doing my leadership courses, which I've done a few, all of them start with doing your personality tests. So it tells you what your strong points are, what your weaknesses are, and there are some of them present which are available online free of charge. So I would say go ahead and do those, because that's going to tell you about what your strong suits are, and you can apply them in your personal development and in your professional development. So in any hospital, this is what the academic medicine chart is. Basically, what we have: different faculties, we have chairs, and then we have the institutional leadership, and where do you actually want to be in this. And some of the leadership qualities that we need to develop in ourselves, I think, really work on these principles which are over here. But communication is strong, has to be strong, which Shazia mentioned. Inspiring others, gaining commitment, be the change. Emotional intelligence, I find, is very important, that we don't really focus on. And then one of the most important thing I would like to mention is mentorship. And in terms of mentorship, I think there should not be just one mentor, because all of our paths is different. As mentioned repeatedly, that all of us have taken the same, undergrad, same medical school, different medical school, but then our path then differ in how we got to where we were. So finding mentors is important. I don't think one mentor is enough. I think that you should have different mentors in different part of your life. It could be your clinical training. It could be your research. If you want to do research, if you want to also in your personal life, I think mentorship is very important to tell you, to help guide you in what you want to accomplish in life, in you as a professional and on a personal level, because I think both of them should go hand in hand. And then what route do you want to take? Do you want to do the USMLE and residency fellowship, or you want to go to UK, Ireland, Australia, or stay in Pakistan and do your FCPS? What do you want to do? And then, or the research route, or a business route, MBA, or become a public health specialist, as Asif and Kashif mentioned, do an MPH or an MHA, or be an MD PhD or an MD MBA, or mixing the two together, or go into teaching. All those things have to be hand in hand, and kind of get an idea of what you really want to do with your life. And there are many motivators for us as physicians. Of course, financial rewards, lifestyle. Some people don't want to take calls; they want to do 9 to 5, or they want to go higher up in academia, or higher up in management, or higher up in teaching. So whatever they want to do, you have to kind of see what motivates you, what drives you. As Amir mentioned, you have to know what your personal likes and dislikes are, what is that you enjoy in life. Because I think the work has to be enjoyable. And if you don't enjoy your work, it becomes very boring. I go to work because I love my work. Patients ask me, what do you want to be? I said, I want to be a doctor. But what if you get a new life? My kid asked me. And I said, if I have a new life and I would start all over again, I'll still be a doctor. So, you have to really like what you do. And to become a leader, you have to have a vision, and you have to communicate, and you have to trust your colleagues and basically foster them. And that is the role of a leader. As physicians, I think we end up being leaders, as so many of us are mentioning here. So there are many things that there are many books out there. Just one of those books, what we need to kind of get over with, and things that we are just normal in our life that we need to get rid of, which are outlined over here. And then skills that we need to develop, and people that we need to foster. And this is just a slide taken from ECFMG, telling us how many physicians there are actually in US, and you can say about 1 million, and how out of them the IMGs are about 1/4, and 75 of them are foreign nationals. So a sizable proportion of these physicians, and this is what the physicians from Pakistan, when they come in as a workforce. And you can see from 2008 to 2018, over 10 years, there have been a steady increase in the physicians that are coming and getting trained in US. And we are the number 4th in the country, India being the first and being a large country. And so there are about 15,000 Pakistan educated physicians in US, and we have increased 32%, as I mentioned. And a lot of them are in primary care specialities. So how can we become involved? How can we empower ourselves? I think one important thing is to volunteer. If there's somebody looking for help, if you be the first one to volunteer, get involved in different committees, especially in your medical schools. I think it's very important to help out in any which way you can. Volunteer, join volunteer organizations, different medical community committees if you have them. Spend your time wisely, of course, and don't volunteer and not be there. So you have to be sure that if you're going to volunteer, you're going to be able to show up to those meetings and to help out in any which way you are possibly able to. Now, we talked about different membership that is available for free for medical students. And it's interesting that in US, you can be an international medical student and become a free member. And you can see that you can put that on your CV. So American College of Physicians gives you that option, and I've put it down over here, that you can join, and it can help you. You can have online access to different courses, how to prepare for internship, residency. There are different tips available. you can do that. If you're interested in family medicine, you can join the American Academy of Family Physicians for free again. And it's outlined over here. And then you can have access to a lot of resources, a lot of mentorship availability, a lot of projects that are going on that you can, as a medical student, become part of. American College of Chest Physicians. So I'm a pulmonologist. So if you're interested in pulmonary, you can join as a medical student and you can submit a case report. You can attend an annual meeting at a minimal cost. You can actually apply for a travel grant as a medical student from a third world country, and they give a bunch of fellowships. From a bunch of these grants are given to come to US to attend these meetings, which is a great exposure. Now, American College of Cardiology also, if somebody is interested in cardiology, you can also become an international member, you can become a trainee member, and that will also help you look good on your CV and also give exposure to a lot of mentors that can be there to help you. So we talked about American Medical Association. There is a free membership for that. They are outlined over here. You can have access to a system called Farida, where you can find out the residency which are available right there. And then I did this yesterday, and you can see there are a few residency spots, internship spots available that you can apply directly, and you can look up. And this is the website given over there. You can look at by specialty, by program ID, and you can have availability of what's out there, what's available directly. You don't have to ask anybody. So again, this is the American Medical, this is another one. This is American Medical Student Association. And again, this also has, I think, programs for international medical students. So because everybody wants, this is a global system now, everybody wants to be involved. And so you can become part of that. Now, this is an interesting program. It's Foundation for Advancement of International Medical Education and Research. This is through ECFMG. And this program, if there is a physician who wants to learn about education method and research and management skills, you can apply for this program, and you can have, this is outlined over here, you have a project and you want to learn about how to develop that project. You can have 3 months of, it used to be 3 months of on-site learning and then 9 months of remote learning, and this is all free. You apply for it, and if you get into it, you can have access to advanced training of applying an idea and developing it into a project. And this is for us, for internationally, people in Pakistan, India, anywhere out there, if you want to apply for it. So going back, how do we improve our CV? How do we can join different organizations, we can join different committees as a student, we can get involved in the ongoing projects. I think sometimes we are looking for a different project, but I think it may be wise to just hook up on a project that's already ongoing, because you will have an abstract out of it, and even having an abstract out of your research or an elective, it's really good. Interesting case, if you look up, I would say every month look up for something, read around the cases. If you read around a case, that's when you find out that there is an interesting case. For example, I went to OJA Institute because they invited me to do a PFT symposium, and I learned over there that actually the way to make diagnosis of TB in Pakistan, in Karachi right now, is by doing a gastric lavage. So that's an obsolete method in America, to do a gastric lavage and diagnose, but that could be a great project to write up for them. And I suggested to them that that would be a great project for them to write up, because right now that's not being done. So a lot of things that you do, that you consider as normal, is in an international world, in US, in the advanced world, that is not considered the standard of care. That is not what we are doing right now. So if you write it up, that will most likely be accepted. And the chances of an abstract being accepted is 80%. versus if you write a paper or a manuscript, your chances are the other way, 20%. So if you have an abstract which has some basic information, and so if you make a case for it, your chances of your abstract being accepted to a international meeting is 80% or more than 80% if it is nicely written. And if you need any help, you can always send it to any of us, and we'll be able to, you write it in such a way that, and we will ask you to add information into it that would make it acceptable, because we have done these so much that we know what goes, so we are able to help you with that. So if you have a option to attend a grand round, get a CME credit for it, please do it. There are a lot of Zoom meetings now. There are a lot of online learning. I think that it goes in. If you can do, for example, for us, we do a lot of lectures and a lot of classes for research training. So we have to do research training modules before we can do research. And for that, you get a certificate. If you're able to do that, those are also can go on your CV, and that tells people that you are actually interested in research and you are taking those courses. Now, I've put in a resources. These are from from the previous seminar that we had on career options, and I just put them all together over here. So these are from Pakistan, Ireland, UK, as Amir mentioned, and also we have UAE resources available. So these are going to be available. These slides will be available for you online for review, and we're going to post them on the Facebook page also. So I thank you for your attention. And I think I'm on time, so we're going to move on. If you have any questions, I think we are on time. I went very fast.
Thank you, Dr. Zina Sabda.
Very welcome. So let me stop sharing and go on to the next. Let's see.
So one quick announcement, like as Dr. Nazir, research professor at GSMU announced that we have a journal. So I will encourage all the participants and the speaker, if you have any abstract or any article to submit, that will be very helpful for our journal. And also, if you want to be a reviewer of your specialty, please email me your information and I will send it to them. Thank you.
Yes, I just want to say that, sorry, Dr. Sbar, can I put one point here?
Yes, please.
Yes, please.
Yeah. In fact, as I mentioned here, that because after we got our journal recognized by Higher Education Commission, a lot of articles are coming, and where policies, we have one international reviewer and one local reviewer. And we get the local reviewer by calling telephone, by email, but we have always problem with the international reviewer. As the Dr. Irfan said, please help us in this regards. Please. Sometimes we send to article to international reviewers, they take a lot of time, and then the author becomes so upset that they are taking too much time. So I really thank you for Dr. Irfan that he pointed out this point, that please, we need international reviewer to review our articles. Thank you very much.
Thank you.
So it's my pleasure to introduce Dr. Mohammad Zishan. He's the Clinical Assistant Professor of Psychiatry. He's a co-director of Medical Student Course and also co-director of the Residency Scholarship Activities at New Jersey Medical School. And he's going to talk about journey across the continuum professional lifespan.
Thank you so much, Dr. Zina Sabda. I mean, it's a really honor to be here. I'm very excited, and I have learned. Actually, I took a lot of notes from the presentation, so it's a really great. I'm glad that the medical students and residents, they are able to have such a heavy resource in such a concise manner. I'm just sharing my slides. I
Yeah,
will try again. Yeah,
we
1
try
minute.
again. We could see your slides before. Yes.
Yeah, 1 minute, please. How about now?
Yes. You
Okay.
can just put them perfect. We see them.
Okay. So thank you so much. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. And as I said, that I'm very excited to be here. It's a really honor to share the life journey. Although you may think, someone which has which have more experience, might be the person to ask, but to share the life journey. But I thought because we are sharing our experiences with our medical students, our trainee, our residents, when I got that opportunity, I was very happy, that I can share what things I have done, what things have been helpful, and what things I have learned, over years that were helpful to achieve my dream and what I wanted to achieve in my life. So I'm clinical assistant professor at Rutgers, and I completed my child and adolescent psychiatry fellowship from Harvard Medical School, Boston Children's Hospital. So beside my child fellowship, I'm also an infant psychiatrist. I completed 2-year infant fellowship from UMass Boston. And over the past 5 years during my training, I received more than 10 regional, national, and international awards from American Psychiatric Association, American Academy of Child and Adolescent Psychiatry. And I think one award that was very highlighted was from the Association of Directors of Psychiatry Residency Training, and the award name was Nayapati Rao and Francis Liu International Medical Graduate Award. So this organization gives this award every year for 5 international medical graduates who contributed significantly in the field of psychiatry. And I was one of the recipients in 2019. And I have been actively involved in APNA, Nishtar Alumni, YPC, which is the Young Physician Network. And I'm currently the chair for NANA Research Committee and secretary for PAPANA, which is a Pakistani American Association of Psychiatrists of North America. So I was, very impressed, and it was very powerful to hear story of Dr. Asif and my disclosure. So I just made changes in my slides based on the things I learned during this presentation. So it was very powerful to hear the personal journey, and so I thought, okay, it may be a good idea to share some personal journey to help our trainees, our medical students, to see what we were before medical school, what we have done, and what things have been helpful. So I grew up in Pakistan. It's in a small town in Punjab. I am eldest among 8. And before going to medical school at Nishtar, I worked in a restaurant for 12 years. That's my father's restaurant as a waiter. And then I'm because I'm the eldest one in my family, so I was supposed to take over my father's business. But I got good score, got into Nishtar. And then I came to United States in 2013, got married here. I have 2 kids, 4.5-year-old daughter, Manal, and 2.5-year-old son, Mikhail. And I did my residency from Bronx Lebanon Hospital, which is a community hospital in Bronx. So a couple of things I will share, but just want to highlight here. I think, Dr. Asif, even Dr. Zeenat, they mentioned about, they didn't have any research background. So did I. So when I started my residency, I didn't even know what are the meaning of abstract, what is the meaning of the poster, what is the meaning of just forget the research or the case reports. I was unfamiliar with all those terms. And I will share, what thing have helpful for me to do all those things. And during my residency, as I said, that I started with no posters, and it's a 3-year of psychiatry residency. And by the time I graduate from Bronx, I have close to more than 20 posters. I received 2 national awards, and I got one of the best program at Harvard Medical School, Boston Children's Hospital, where I completed my fellowship. And during my fellowship, at my graduation, I was one of the recipient of 2, I think, regional, 3 national awards, and a lot of teach and a lot of experience in the teaching, which I did at Harvard Medical School. And currently I'm working at Rutgers, where I am teaching medical students and residents in New Jersey. And so that's a little bit background. And so as I mentioned, that I'm a child psychiatrist and an infant psychiatrist. And because of my infant background, so last year in October, I invited one of my mentor, Dr. Harrison. She is a faculty at Harvard, a very well-renowned expert in infant psychiatry. So she came to Pakistan with me last year in October, November. We visited Karachi, we visited Aga Khan, Dow, JPMC. Then we went to Lahore and Multan, and we did a lot of workshops there where we educate, help parents and midwives how to build that bond at a very young age. And because of that project, we just recently launched, because of the COVID, we were unable to go back. So this on the flyer that you may see on the right side, we just started earlier this year, after COVID, we started some remote teaching in villages in Multan, their peripheries, where we trained almost 50 mothers who have 3-month or less baby, how they can talk to their babies. And we are expanding our project to other districts in Multan. We also recently started in Peshawar. And I'm also in the process of starting first transgender mental health in Pakistan, mostly in Lahore. So reason for sharing, so I just want to share these things first before I go to the presentation. Just want audience to imagine, someone who is working as a waiter, who was, and I didn't mention, I was the first one in my family who went to in high school, and then who was supposed to take over the business, and then having that journey from Nishtar, from Bronx, from Harvard. And then, my always dream and goal was to do something, on parenting. And then having my mentor go with me to Pakistan, and we started all this project. So just want to share, that journey. And then based on that journey, I would like to highlight what are the things, that I struggle a lot during this journey. And I have seen, as I mentioned, that I have been actively involved in mentoring medical students, residency applicant, mostly in Pakistan. And I have been, providing mentorship. So I have heard the same stories, the same struggles that I have faced. So I just want to share those and how to overcome. So the first thing that come into my mind is this notion of I'm not good enough. So I'm not good enough. I think Dr. Amr Barni, I think touched Dr. Zina Safdar touched in a really good way, especially students who don't have, the research background. And now they had this seminar, it's an amazing seminar with the experts all over the world. And, and now the next question is, okay, no, I need to start. But then the moment you start doing it, then this question, because it may be hard in the beginning, and then this notion is, maybe it's not for me, I'm not good enough. So how you develop some capacities, and I will share some examples. And the second thing which I have seen a lot and as I said, that I'm a psychiatrist, so definitely I'm focusing a lot on psychiatric aspect of medical student, residents, trainee. That what are the different, the aspects that may come into play, when we are, our day-to-day interaction with our patients, with our colleagues, with our family members, or when we are applying for something, to US or UK or other countries. So what are the common challenges that can be faced? So one is the low self-esteem. One other is an anxiety, and the third is the fear of failure. And I know, because this is a match season in US. Match season means that people are applying for residency in US, and there are so much, the desperation, so much chaos, and during that time, how you instill some hope in the applicants, and how you instill, some hope in the medical students who doesn't have any research background but want to learn or do, who is very passionate to do things but doesn't have those background, and very much, afraid of, oh my goodness, I'm pretty sure I will fail. So how you instill hope in those students and residents. And the third thing, which I think couple of, I don't have, I think one or two speakers touched on the comfort zone. So how, what is comfort zone? What are different strategies to come out of comfort zone, and how it is important to, to come out of comfort zone. And when I was listening to this presentation of Dr. Shazia Maqsood, and she was amazing presentation. She touched really great points on empathy, active listening, non-judgmental talking. So it just compelled me to share just to what Dr. Shazia explained in a really great way, just to highlight the importance of the empathy, and then help differentiate what is the difference between a sympathy and an empathy, and why it is important to be more empathic. So first, how to deal with I'm not good enough. So I just want to share a story. And one thing, you may realize psychiatrists, they love sharing stories. So that's what I have learned, and that's what I will do. So I will share a couple of stories. So this is a story of group of people who decided to reach at the top of the mountain. So the people, they divided into three groups: Group A, Group B, Group C. And it seemed like a very impossible task to achieve. And then first Group A, they started climbing up on the mountain, and they were reaching and kept encouraging each other. But at some point, they all start getting tired, fatigue, and one by one, they are coming down. And then when they came down, the Group B, they start feeling happy. They said, the Group A people, they may be lazy, they may be, they don't have a courage. So they start going up. And they went a little bit far where the Group A went, but they also start getting tired, and they also came back. And then the Group C started, and they went really far. But then people start getting tired. Someone fell down, someone got injured, and the people from Group A and Group B, they start shouting, please come back, we don't want you to get hurt. It's a very the hard path, no one ever achieved it, so why you are trying? So that's where and then most of the people, they start coming down except one. That person just kept going on and on and on and on. People have seen him falling down, failing. I think Dr. Bernie, I think I touch on don't give up. I really like that concept. So that person just kept going on and on, and people were shouting, who like you, we know that you are very passionate, but we all know it's a very hard path to go. We have been seeing you have been failing so many times. That's okay, it may be not for you. But that person just kept going on, and then that person reached on the top of the mountain. And then everyone start clapping, everyone start excited and celebrating with that achievement, and wanted to know what is the key for that person to reach that, to achieve that success despite all those adversities. And that person came down, and everyone was excited, wanted to meet that person, but that person just ignored everyone and just start going to the opposite side. And then later people realize, that that person was deaf. So what the moral of the story here is, a lot of time, especially as I said, I think a lot of you have heard a lot of international medical graduates, people who are don't have a lot of research background or medical background or educational background. So there are a lot of a lot of this notion that that I may not be good enough, or it's and people may have some discouraging remarks. Especially I remember when I was trying to come to US, and I was thinking of applying to psychiatry. So a lot of people were telling me, it's psychiatry is someone who really good in English, who is someone who is really well versed in US culture, who is someone who, and when I told them, I want to apply in child psychiatry, so people were saying, you really need to know about the school. So maybe this not maybe the field. So what's the moral of the story from the story that I just shared about, the person who achieved, who was able to reach, is that sometimes, it's just good to ignore those, you just believe in yourself, you just stay confident, you just keep trying, and, just hard of hearing when people tell you that you cannot fulfill your dream and goals, being hard of hearing when people tell you that you can't make it, being hard of hearing when people give you unconstructive feedback, and being hard of hearing when people try to put you down. And you may come across, especially when you are trying to achieve your goal, when you are trying to do something that you are not good at, when you are trying to come out of your comfort zone, you may come across this lot of these kind of notions. And I want to share my personal experience. So as I said, that I went to public school system, definitely not good in the English communication. I had good scores, so I came to US. I started my first observership at a program, and after the observership, when I asked for the feedback, so the feedback I got was that Dr. Zishan, you are really good. You are a really good clinical knowledge. You really take care of your patients, but you need to work on your English. Your English I think Dr. Shazia Maqsood, I think, mentioned a lot on the communication. So that was very kind of not shocking, but little bit kind of discouraging. And I knew that this is something I may need years to work on. So that was the feedback. So then I asked, that person who gave me that feedback, what can I do? And that person just smiled and told me, have a girlfriend. And I said, okay. And then, I took that feedback. I think he just wanted to make me feel better because he saw that, the sadness and desperation on my face. So anyway, I did some externship, and then I went back. So I did my observership in May of 2013, and I went for interview to that program, I believe in December of December or January of 2014. And the same person interviewed me, and he said, wow, Dr. Zishan, your English got really better. I mean, your vocabulary got better, your communication, your pronunciation. What did you do? I said, doctor, I just followed your recommendation. He said, what do you mean? I said, I got married. So he said, but I asked you to have a girlfriend. I said, that those things doesn't work in our culture. And so what I was, what I'm trying to say here is a lot of time you get this feedback, and you cannot let those things to rule you or ruin your ambitions or ruin your, the dreams, or let you down, that you maybe, you may need to think of something else. Anyway, before I go to the next slide, later I realized, that in order to learn English, you don't have to get married. You can learn with some other ways, but I think it was too late. So then let's talk about the comfort zone. So first of all, what's the meaning of comfort zone? So comfort zone mean that something we are good at. For example, I mean, I can share my example, which I hope resonate with a lot of our medical students and the audience, that I was good in studying. I was, that's what I did in medical school. That's what I did in my USMLE. I got good scores. But when I started my residency at Bronx Care Hospital, as I said that, I was seeing my other colleagues who have 5 posters, publications, who have MPH, someone has 5 years of research experience at Columbia, NYU, and I was just so and I was just not sure what to do, because I always, one thing people commented about me, that I always curious to learn, try to do things that I feel can be helpful. So my comfort zone was reading, spending time with my patients, reading psychopharmacology, reading all the books of the diagnosis. But but my out of comfort zone was doing this, the posters, publication, writing, and then I said, okay, I will try. So I tried, to learn about it, and believe me, I wrote my first abstract, just an abstract for a poster in 1 year. It took me that long, and then I started questioning myself: is it worth of my time to do something that I know that I'm not good at? Is it worth of time to do something that I know no matter how hard I do, I will not excel on those things? Or is it worth of my time to do things that make me more frustrated and make me more disappointed? Or should I just spare my time to things that I'm really good at? Scores, exams, reading, teaching. And so that was one thing that was, I was very confused during by the end of my first year of residency. So I went to my training director and my chairman and shared my, this confusion. And I think they shared almost the similar, but I think a lot of our speaker mentioned that don't give up, change is hard. Coming out of comfort zone is hard. But once you realize that is important, you need to start with the, I think Dr. Kashyap mentioned, with the low hanging fruits. You need to start, you need to take baby steps, and you need to ready, I think what Dr. Barney mentioned, you cannot give up. You just fell down, you just keep trying. And honestly, I think that was a really good feedback that I got that really helped me to come out of comfort zone, which was really hard. I questioned myself many times. But as I said, I wrote first abstract, and interestingly, the first abstract got rejected. So that was even discouraging. But because I had good mentors, a lot of Dr. Kashyap mentioned about the mentorship, Dr. Zinat mentioned about the highlight the importance of mentorship. So I got really good mentors who helped me, who encouraged me, who believe in me, when I was even having difficulty believing in myself. And because of all that support, within 2 years, as I mentioned, that I presented almost 20 posters in national conferences. I did 2 or 3 quality improvement projects during my residency. I wrote, the institution review board, and then because of all that work, I was accepted for my fellowship at Harvard Medical School. So just want to share. I thought, sharing some personal journeys may help our audience to see, that it's not easy to do these things. You may stumble upon. You may get discouraged. You may feel frustrated. You may feel angry. You may feel, you may hear feedback, even from your friends, family, who really care about you, who don't want to see you in struggle. You may hear these things, but if you are passionate, if you know that this is something is very important for my career, if you realize, with these conferences, with these seminars, with meeting with your mentors, this networking, like you need to work on networking, you need to reach out to mentor, you need to do some poster, once you realize and once you know that those things are important for what your goal is, what your dream is, then you just push yourself to get out of that comfort zone. I think a lot of the speakers mentioned in a really great way with a lot of great examples, how you can come out of comfort zone, networking, attending these kind of seminars, reaching out. There are so many, I think Dr. Zinat shared so many resources. You can join so many groups. There are so many Facebook pages that you can reach out. Same thing with the mentorship. And I really like, the idea of Dr. Zinat mentioned that, it should not be one person. There may be a lot of mentors. And then, as I mentioned, attend seminars, start with the low-hanging fruits, as Dr. Kashyap mentioned. Just briefly about my second objective, which I was trying to highlight, like why it's just like when you are preparing for your prof exam, and when you have those 2 months before exam, so everything seemed, because of the stress, everything seemed dark. You are more angry, you are more frustrated. And the same thing during the match season, or the same thing during just a couple of days before your USMLE exam. So why during the stressful time you become more angry, you become more irritable, you become more more frustrated, or you have more self-esteem, or you start perceiving things that are negative. So many good things are happening, but the things that you are perceiving is negative. For example, simple example could be that this is a match season. You may know that people are getting interviews, but because you didn't get the interview and you are stressed, so you are picking up things. Oh my goodness, that person has this good scores, he didn't get the interview, so I didn't have any chance. So your vision may get tunnel vision, that you may start noticing more the negative aspects. So why that happens? So just the neuroscience behind that. So Dr. Dan Siegel is a very well-known psychiatrist and a neuroscientist in US, and he explained, he divided brain into two. He called his a hand model, where he said the fingers is your prefrontal cortex, which is mean your executive part of the brain, or in a simple way, your thinking part of the brain. And your palm and your thumb is your lower part of the brain, which is, we call it an emotional brain. So whenever there is a stressful time, whenever there is a kind of a failure, whenever there is a negative feedback, whenever you had a small failure, so your lower part of the brain get activated. And what is the function of lower part of the brain? As we know, it's a sympathetic, parasympathetic. It's either fight, getting more angry, more irritable, which may affect your relationship or so many other things, or um, fight or flight, or you may run away. You may avoid doing those things. You may start keeping yourself away from people who are involved in those projects, or and because the lower part is activated at that time, and you start perceiving more negative things. So then what can you do during that time that can help you to activate your upper part of the brain? And one thing, again, based on, I'm talking mostly in context of our international medical graduate background, is that we are very hard to ourselves. We don't appreciate what we have done. We don't reward ourselves to the small efforts. We just are, if you are doing 10 good things, and if you are not doing one, and if you're not good at one thing, you start very self-critical, very harsh to yourself. And but the irony here is that because as a doctor, as a physician, you're very kind to your patients, you're very kind to your family, you're very kind to other people. But once it's come to yourself, it's completely opposite. Let me just share you another brief story, and then I think I have 2 or 3 more slides. So this is a story. This is a really good story. I will highly encourage parents. It's available on Amazon. It's called Listening with My Heart. So this is a small, beautiful girl named Esperanza. So Esperanza, it's a very well, behaved child. She's a 8 to 10 year old in, in the elementary school, and very loving parents. So one day she's about to go to school, and she stepped out of her house, and she saw a bunny, who was just making some noise. She realized the bunny was hungry, and then she took out some carrots from her lunchbox and gave it to the bunny, and bunny got happy. And then she went to school, and when she went to school, she saw another boy who was very sad, just sitting on a bench, tearful. And she never saw that boy in the school, and she thought, maybe this is someone new in the school, maybe he is very sad. And then she just throw a ball at him, inviting him to play. And and then boy kept sad. She went to him, asking what's going on. She was very kind, very the trying to understand what is happening. And because of her kindness, that boy got they became friends. In the evening time, Esperanza has a performance at a stage, and then just a moment she was about to step on the stage, she slipped and ripped her dress. And because of that, she just got distracted. She didn't perform well on the stage, and her team, the performance team, got failed. So she came home, and she was very self-critical. She's just kept saying negative things about herself. I failed my team. I'm not good. I should not have done this. Why even I thought. a lot of negative things are going. And when she came home, her mom saw her and asked her, Esperanza, what's going on? I mean, you are very happy every day. And then she shared, how was the day? And then her mom asked Esperanza, can you be kind to yourself, just like you were kind to that boy that you met in the school? Can you just forgive, that mistake that was, just accidentally happened? Can you just let it go and see what else, you can do, or how you can perform it better? Can you do that? And that was a really great lesson that I learned. A lot of time as a physician, we just dwell on negative aspect. We just keep pushing or being hard on ourselves. So sometimes, in order to activate your brain, especially during the stressful time, is just some deep breathing. Just call some friend, call your parents, call someone who really cares about you, or if no one is available, just just think that yeah, mistakes happen, accidents happen, mistakes happen. You learn, and you learn from mistake, and you move forward, rather than just being self-critical. And this is I will stop sharing here, because I have a YouTube video, because it's a really great way of showing what's the difference between sympathy versus empathy. So I will stop share and then share a YouTube video. Just give me 1 minute, please.
So what is empathy, and why is it very different than sympathy? Empathy fuels connection. Sympathy drives disconnection. Empathy, it's very interesting. Teresa Wiseman is a nursing scholar who studied professions, very diverse professions where empathy is relevant, and came up with 4 qualities of empathy. Perspective taking, the ability to take the perspective of another person or recognize their perspective as their truth. Staying out of judgment, not easy when you enjoy it as much as most of us do. Recognizing emotion in other people and then communicating that. Empathy is feeling with people. And to me, I always think of empathy as this kind of sacred space when someone's kind of in a deep hole and they shout out from the bottom and they say, I'm stuck, it's dark, I'm overwhelmed. And then we look and we say, hey, you can climb down. I know what it's like down here, and you're not alone. Sympathy is, ooh, it's bad, no, you want a sandwich? Empathy is a choice, and it's a vulnerable choice, because in order to connect with you, I have to connect with something in myself that knows that feeling. Rarely, if ever, does an empathic response begin with at least. Yeah. And we do it all the time. Because you know what? Someone just shared something with us that's incredibly painful, and we're trying to silver lining it. I don't think that's a verb, but I'm using it as one. We're trying to put the silver lining around it. So, I had a miscarriage. Oh, at least you know you can get pregnant. I think my marriage is falling apart. At least you have a marriage. John's getting kicked out of school. At least Sarah is an A student. But one of the things we do sometimes in the face of very difficult conversations is we try to make things better. If I share something with you that's very difficult, I'd rather you say, I don't even know what to say right now, I'm just so glad you told me. Because the truth is, rarely can a response make something better. What makes something better is connection.
Okay, let me just share my slides, and it's 2 more slides. Oh, one. So So that was sympathy, and I will be more than happy to answer any question. Okay, and then I think, okay. Okay, and then the last thing I would like to mention, again, I think Dr. Shazia Maksud mentioned in a very good way, you know, a lot of time, there's a lot of judgment, you know, when we are interacting with our patients, and even, I think, even with our family, even with our friend. And a lot of time, I think what Dr. Brenes Brown was trying to say in the video is a lot of time we try to fix the problem. So let me share a 5-step approach. I will try to share in less than 5 minutes. So a 5-step. So let's think about. Let's take an example. Let's take an example. Okay, let's take an example. You know, you are a mentor, and your mentees came to you and told you that, you know, that I failed my step 1, or I failed my prof exam. And a lot of time, what's you know, a normal, I would say, our average way of saying it, you know, people try to make them feel better. Okay, that's okay. You know, you can do better in your step 2 CK, or you can do better, you know, in your next exam. So we just try to jump directly on doing, like trying to fix the problem by giving some suggestion. That's the 4th step. But what I would like to share, you know, the 5-step approach is, so the first step is, you know, whenever someone, your friend, your family member, your patient came to you, you know, with some stressful situation, the first thing you yourself have to remind yourself that you need to stay calm. And I think, as Dr. I think Brenes Brown mentioned, it's very hard to stay calm when you know that you can fix the problem, you can help it, or, you know, you can, you have a lot of experience. It's very hard to stay calm. Or sometimes if this is someone really your loved one, as I said, I'm a child psychiatrist, parenting expert. So in a parenting concept, you know, if a child did something wrong, so it's very hard for you to stay calm. But you have to remind yourself, because the more I stay calm, the better I can help, you know, my patient, my friend, my family member, be helpful. And the analogy that I gave is a funny analogy. Hopefully that will help. You know, that in a relationship, you know, for example, if a husband is you know, getting angry, getting mad, and the wife, you know, although she knows that it was husband's fault, but if she also start getting mad at the same time, things will get worse. But if wife realize, you know, yeah, I know that this is his fault, he is angry, but maybe this is not the right time to tell what he has done wrong. So if she stay calm, there maybe you know, the sooner they can solve the problem. So the first step is you need to stay calm yourself. The second step is you need to validate the feeling. You know, you seem pretty upset, you seem pretty sad, you seem pretty angry. And that I'm going a little bit fast because I know I have 1 or 2 minutes. And the third step is collaboratively explore, you know, what has been happening, what's going on. You know, try to understand, you know, what were the reasons, you know, what and how it making it feel, what are his concerns. His concerns, maybe if I tell my parents, you know, if I tell that person. So try to listen it out, and then you know, share some you know, then share some suggestions based on all those you know, following those steps. And why it is important. Remember, I showed you the hand model. So when someone come with a problem, so the lower part of the brain is active, and at that time, if you try to correct the problem, you know, so you are basically try to you know, put water on the fire when the lower part of the brain is on fire. But if you stay yourself calm, you validate the feeling, you collaboratively explore, and then suggest something. So by doing those 3 first steps, you activate that person's upper part or the thinking part of the brain. So then what you can tell, you know, either it's in the parent, either it's in the patient relationship, either it's in the friend, either it's in any scenario. When you tell some solution, then that person will be more able to take that message. And the last step is then you reflect, you know, what have worked and what have not worked. So I will stop. Thank you so much again for the opportunity, and I will be more than happy to you know, answer any question later. Thank you.
One second. Sorry. Thank you very much. Great, very inspirational. I learned a lot.
Thank you. I'm happy to be here. Yeah, my pleasure.
I'm going to let Mona.
Yes. Yes. Can you hear me?
Yes.
Yeah. So I'm going to introduce our next speaker, Dr. Rizwan Naeem. He is Professor of Pathology, Director of Molecular Genetics Pathology, and American Board of Medical Genomics Lab Genetics Fellowship Programs at Albert Einstein College of Medicine. And he has a big legacy for career symposiums and career guidance for young physicians in up now more than 25 years. And he has this whole group of new physicians, which include a lot of you who are taking this legacy forward to actually new generation of the students. So Dr. Rizwani.
Great. Thank you. Dr. Naeem, I can't hear you. आप muted हैं. You're still muted? Yes.
Yes. Okay, so let me share my screen. So first thing I want to say, this is the first meeting to maybe many years where I did not move. Each and every speaker was just amazing. And I learned so much from this seminar that I cannot tell. I've done seminar with many of you, and Zishan as always is amazing, but Amir, Zishan, and everyone actually was just amazing. And what I wanted to say that I've been, as Naumana said, I'm an old guy. I've been in Apna for many years. And I've been chair of Young Physician Committee of Apna for many times. I've been chair of the CME Committee, Educational Committee of Apna for many times. But this seminar, Zinat, what you and Irfan, you have participated, is the best I've ever attended. That's what is minimum I can say. So with can you share? Can you see my screen?
Yes.
Okay. So I'm trying to put it on presentation mode. Yes. So what I wanted to say is my presentation is short, and I'm going to just be empathetic to Zishan and share one of my story. and so when I came to United States, as you know, genetics in our medical schools, how much do we learn? And somehow I was interested in pathology and learned about genetics, and someone introduced me. And I did my fellowship, one of my fellowship at Brigham and Women's Hospital at Howard Medical School. So, and one day when I went back to my mentor and asked for feedback, he gave me a coupon. And that coupon was to attend English writing skill sets. So you said, Rizwan, you're great. You're here before everyone else. And I be here after work also. But I want you to go take this free classes, which is offered by Harvard Medical School. And you need, that will help you write things. And that was the best advice I think I got from my mentor, who rather than giving me a gift, he gave me a coupon to go learn how to write English. And that is an amazing, that has helped me in doing a lot of things which we have done in many decades. So I want for students, if they want to, if they are looking for alternate careers, if you just go to Google and search for alternate careers in healthcare, you will come up with a list of seminars, and one of the seminars is from ECFMG and AMA, which we did in 2018, which is about what many different careers are available for healthcare for IMGs if they are interested in alternate careers, or if they somehow did not get into residency and say, for example, I did not patch, what is next, what should I do, type of thing. But today what I'm going to do is just to talk about genetics so that seminar is very detailed, many different presenter, including me, talking about genetics, but there are other carriers also. So, but why do we need alternate carriers? For example, when I was growing up in mid-80s, the 70s, when I was going to college, so there was no choice of other carriers. Either if you're good in maths, you go to engineering college, or if you're good in biology, you go to medical college. So somehow I was not a good student in math, so I went to, by default, I go to medical school. And but many people nowadays have careers. I mean, even if you have done medical school, you have a choice to go to whatever field you want to go. As I mentioned, both of my kids, none of them want to do medical, and one is an engineer and one is in psychology and media and so on and so on. So there are so many good careers, but if you want to do something else, how can you take advantage of your medical skills and be an alternate carriers? So the question I wanted to ask for genetics, medical student may ask, what is genetics? So easiest thing I would recommend, there are many resources. One resource is American Society of Human Genetics. So if you just look into their career alternatives, career options, you can come up with many, many different careers in genetics, which include your medical degree or may not include your medical degree. And you can take advantage of that and why become a geneticist and how to become a geneticist. So rather than me giving you the whole detail, I would say just go to ASHG, American Society of Human Genetics.org, and you will find detailed videos and presentations on what medical genetics is and what you can do, how you can get to that skill set. So what skill sets, abilities, or personalities and characteristic genetic poses? So the reason I like genetics, because one of my chairman in pathology department at Harvard University was Ramsey Cotran. Ramsey Cotran is the book we all read about pathology. Ramsey, Kumar, and someone else, Smith, I guess. So Robbins, Ramsey, and Robbins, Cotran, and Kumar. So that in his office, he has written in his board saying that when I was a student, genetic was an option and I should study or not study or do or not do. But what I believe now is genetics will be part of every subspecialty, irrespective if you are a pulmonologist or a cardiologist or a pediatrician or a psychiatrist, you will need to deal with genetics. And genetics is changing medicine every day, if not every week, if not every day. They are one of the best medicine for COVID treatment actually is because of research we have done in genetics, because of genomic sequencing and sequencers we have developed. And now you can use those RNA, clips of RNA, and make it stable and introduce to human body, and that can generate the T cell response or memory in T cells if the COVID attacks you. So that type of change in medicine really inspired me to be in genetics. But you need to be inquisitive, you need to be persistent, you need to be ready to learn every day. I think that's what geneticists do. So what are the main different areas of genetics, overview of genetic carrier, for example? So there is a insignia at the end of the slides called PSMG. So recently, with the help of one of my students actually in genetics and two other genetic counselors, and with the help of JCViana alumni, we formed a society called Pakistani, not Pakistan, but Pakistani Society of Medical Genetics. And that is our objective, to introduce how many career opportunities in genetics in US and abroad and in Pakistan. We have partners in England, we have partners in Australia, and hopefully we have done one seminar recently. We will continue doing about these seminars, to watch out for it. Any one of you who is interested in knowing about genetics, want to help Pakistanis in genetics, please join us. So Pakistani Society of Medical Genetics is done by a mission is to enable the provision of affordable medical genetic services to the people of Pakistan and to create awareness of genetic disorders through education, community outreach, and research. Founding members are, as I said, Aisha Furqan, she's a genetic counselor. Maila Ashfaq is a genetic counselor in Houston. Aisha is in California, Northern California. Ijaz is one of my ex-trainees, now a clinical geneticist in California, and myself. But we are recruiting every day new people who are interested in helping in genetics. So that is, keep an eye on that. Then, what is our aims and objectives for clinical services, laboratory services, education services, and community outreach? So for clinical, US-based geneticists and genetic counselors are working together to provide clinical genetic services through telemedicine. We have already started a clinic which runs every week at National Institute of Child Health, NICH, in Karachi, Pakistan, where we see patients for different conditions and counsel them as needed. And then we are in a planning phase to start a prenatal genetics counseling clinic also with the help of one of our ex-alumni, Dr. One of our student and alumni now, Dr. Shama Manem. She was the professor and head of OBGYN at Aga Khan, now is doing some private practice in another university at Medicare. So we also want to enhance our goal to have affordable genetic testing available for the residents of Pakistan. As I believe and many geneticists believe that genetics basically is a new community medicine, new preventive medicine. By identifying certain lethal genetic conditions or disabling genetic conditions, we are helping medicine by decreasing the burden, disease burden on society. And it's a personal choice, of course, that what you do with that choice, but at least people should have a choice that they should have a kid with SMA, spinal muscular atrophy, or Fragile X syndrome, or cystic fibrosis, or they want to make a choice and wait for a chance, because in autosomal recessive diseases, you always have a chance, 1/4 chance of having a normal child, half a chance of having a child with a carrier condition, and only 1/4 chance of having an autosomal recessive, both alleles present. So that's a choice people have to make, but we believe that that has decreased disease burden in US for cystic fibrosis, SMA, and many other conditions, and hope that will happen. This will happen in all other parts of the world also. We are also interested in education part of genetics in Pakistan. We are actively working toward increasing the presence of genetic professionals in Pakistan by starting genetics certification program. As you may know, there is not a one certified genetic counselor in Pakistan, or there's a program. And there's only one clinical geneticist who is at Aga Khan Hospital and is overburdened by the case workload we have. So hopefully with this effort, we will train more people and educate more people. We want to increase awareness of genetic disorders in Pakistan through community outreach. So for any one of you who is interested in helping in these efforts, please come join us. So medical geneticist is two end. Basically, there's a front end is in clinic, as you may see, and there's a back end. So medical geneticists, medical school graduates with specialized training in hereditary disorders and board certification and cancer genetics are the front end for medical geneticists. And then genetic counselors are also very important part of this this puzzle, and they are at the front end also, and try to counsel patients before testing and after testing, and in certain dysmorphology conditions and cancer. Then the back end of genetic network is really biochemical testing done in biochemical genetics lab, cytogenetics lab, and molecular genetics lab. They are professionals with laboratory directors, genetic counselors, laboratory technical staff, bioinformatics. If you are very interested in bioinformatics and have medical background, I think that genetic is a very, very good career for you. And report assembling and dealing with day-to-day issues. So medical geneticists work at the intersection of research and clinical care. Scientific and technological discoveries are constantly transforming our understanding of genetic disorders and impacting every medical specialty, as I mentioned. Increasing demand for medical genetics professionals in clinical and laboratory setting, in academia, government, and industry. That is happening in US, and this is the highest growth area people see in next 4 to 5 years. There has been a better time, there has never been a better time to be in medical genetics field. So as I said, you can be a clinical geneticist, clinical laboratory geneticist, genetic counselors, and other health professionals in medical genetics and genomics. So major clinical subspecialty which are already being helped by geneticists are prenatal medicine, pediatrics, as you may know, in dysmorphology, neurology, metabolic, endocrinology, oncology, cardiology, and pharmacogenomics. Geneticists is now synonymous with medicine. Not one area of medicine is spared from genetics. So these are the, I want to leave time for people to have questions, as many of you have presented fantastic presentation, and you should have time to answer some questions. So this is called American College of Medical Genetics, and there are many resources available. There is a YouTube channel for ACMG, there's a Twitter and Instagram and Facebook resources available. There's a graduate medical education in medical genetics and genomics. ACMG brochure is available, which gives you information. And as someone was mentioning, one thing good about United States is that if you write an email, someone will reply to you. So if you write an email at acmg.net, I am sure there is someone will reply to you for any questions. So then there is a board called American Board of Medical Genetics and Genomics, which certifies various subspecialties in medical genetics. For example, clinical genetics and genomics, clinical biochemical genetics, clinical laboratory genetics and genomics, medical biochemical genetics, and molecular genetics and pathology. Similarly, there are American College of Genetic Counselors who certify people who are masters and doing. So for example, one of the advice I give to medical students who are interested in coming to United States, that, if you have time, if you are studying, if you after in your medical school or after your medical school, try to do a MS or PhD while you are a medical student, while you just finished your education, and that helps you open up many directions in career in US. So foreign medical graduates, once you graduate, there is a website by American Board of Medical Genetics and Genomics. And if you submit your CV and credentials to that website, it gives you, so medical, I don't know if many of you know or not, but you don't have to be ECFMG certified to go to some of these medical carriers, genetics carriers in US. So if you are PhD, if you are master's, if you are MD, basically after not a bachelor's, but master's degree, of somehow you have many opportunities in US, especially in genetics. So what is the job demand of geneticists? So job demand of geneticists, really, I can give you my example. As many of you have seen over the years, I do not work on the weekend. I do not work after hour. I do not carry a beeper, but my salary is decent, not as someone mentioned about brain surgeons or or a cardiac surgeon, but in many professions, it's about the happiness you can have with the career. Money is also time. So there is a decent career opportunity in genetics, I would say. And this is, as I mentioned, that Pakistani Society of Medical Genetics, Pakistani Society of Medical Genetics, please join us. And if you have any questions about genetics, these are the website. Our website is PSMG, Pakistani Society of Medical Genetics.org. You can just go to that website, write your question, and put your email on. We will put you on for our regular announcements and seminars and question and answers. And if you are interested in mentor, we already have connected many medical students and other students to a right mentor. You can always email us and fill out a Google form which is on our website to evaluate as how we go. With that said, I want to thank you again for organizers and JC Nuana for putting together a wonderful, wonderful seminar. And let's open up for question and answers if there are any. Zina?
Yes, I don't have any questions from students, and there are no questions actually in email, but I have a question actually for our speakers, and I think all of you can contribute to it. As an educator, teaching students, and from the students' end, the biggest challenge of these times is all those PPE with COVID, which has affected our communication skills. So starting from Dr. Shazia Maqsood, I would like to ask all of you what you are going to suggest. Like, is your face is covered with a mask, the patient cannot see your smile, your student cannot see your smile, it's only your eyes, and you cannot touch the patient, and you have to keep a safe distance from the patient. So I would like to.
I would say you have to learn how to speak with eyes.
Bilkul. And if you're smiling, it will reflect your eyes. I tell my students that if you smile or if you frown, either way, your eyes will tell the story. So
yes,
in our culture, कहते हैं ना कि आंखों से पता चल जाता है, which is exactly right. Because
आंखों से सब हाल पता चल जाता है जीनत.
जी बिल्कुल.
रिजवान भाई, कॉलेज के जमाने में तो हो जाती थी ये बातचीत, अब नहीं हो सकती.
आंखों की गुस्ताखियां माफो.
Joking aside, it's really difficult, to communicate with the patient, to examine the patient. Actually, if a patient is COVID positive, we actually don't go in the patient room. One physician per day goes into the room, and the rest of us, we communicate with them by FaceTime, or we communicate with them by iPads that hospital has provided. So it is a challenging time that I think all of us have to, even all the seminars, conferences, observerships, electives, students, volunteers, everything has been affected and cancelled. So we just have to do the best we can. I can tell you that, for example, for us, what we did when we are a research center, we do research. What we did was, because we could not see patients anymore, we changed our focus and we went to registries. So we started enrolling patients in registries. We started looking at our organization and improving our organization skills. So we kind of modified our modus operandus at our institute, and that's what we did. For Jesamiana also, that's what we did. When we saw that we are not able to do these all conferences, we organized webinars, we improved our websites, we just improved our membership. So we actually changed our focus. So I think as a student, they can also do the same, that you change your focus and go online courses, online seminars, you print out your online CME certificates, and show that for that period of time when COVID was happening, I was not sitting down waiting for some silver lining. I still went on and did something.
I think that's a very brilliant insight, Dr. Zeenat. And I think, Dr. Nagmana, apart from your eye contact, your voice throw is also very important, as we were talking about it earlier. The way we throw our voice to the patient, be it mild, be it calm, be it a bit louder, that also explains our expressions. Now, having said that, obviously the new world order of COVID is not going to end any sooner for the next 2 years, perhaps 3, if things are getting settled after the worldwide vaccination. And until then, as everybody is understanding that everything is going to be majorly online, I think it's up to JSMUANA now to have the next Congress about how to run online studies and education in this world of COVID, for students, and especially for trainers like you and us. How to run between Zoom and go to meetings and all these kind of things, and how to get the best out of Zoom. So I think that's the new world order now. But voice throw, by and large, summing it back, voice throw and appropriate eye contact is the mainstay.
Yeah,
and body language, I believe you said.
Absolutely.
Also. Yes.
Non-verbal cues, yeah.
Yes, and the other thing I would like to mention is, so Dr. Dan Siegel have this phrase is called name it to tame it. So name it to tame it mean is that you basically name the feeling. So for example, and don't assume, patient is sad or patient is angry because of, your mask. Ask the patient or comment on the patient. Like, for example, if patient seems sad, just labeling that feeling that, you seem sad, or labeling that feeling, you seem angry, or asking him, I know this is very different. How do you feel about it? So that will help to ease that relationship rather than, just going directly with the question. So I think feeling, validating the feeling, I think, and then labeling that feeling, I think that may help ease some of the struggle, but this is definitely a very tough time. Thank you.
So there is a question from one of the audience that she's a third-year medical student. How can she learn more about PSMG? So I would say we love to do more and more for medical students. And Rahat, if she's still there, I want you to please pass this information to medical students that that they can go to our website, PSMG, Pakistani Society of Medical Genetics, and .org. And you can fill out a form and we will reply to you, or email to us and we will reply to you. We are planning to do a massive project in a sense for medical students as to see where we are for teaching genetics and genomics to medical students and what we can do to help their curriculum for more with the genetics and genomics, especially as it transforms to psychiatry and many other specialties.
Thank you very much, Dr. Rizwan. I'm always there to help you out.
I'll contact you privately, and we have a questionnaire. We want to see as many medical students can fill that out. And so that's a project for one of the students here. So that will be a good collaboration, and most importantly, to update our curriculum with the new medicine which is available.
Agreed.
And I hope Asif and his team are also working towards that and providing the resources how to update their curriculum, because that's one of the important needs in Pakistan.
Bilkul. Thank you so much. And as they say, learning is a lifelong journey, and I learned a lot today from all of you. It's really, really exciting to see all of your commitment to education and research, and I really appreciate all your help. So hopefully in next coming months and coming years, we will be able to do some more online till we get back to our normal regular routine of meeting in person. So with that, I'm just going to call this meeting to an end. If there's no other question, I want to thank each and every one of you for being such a good sport for being so excellent presenters, giving us excellent presentation. These are going to be posted online and disseminated between to those students. So it will be a great resource, which will be on the JSMU website also. So this is something that will go on for a very long time, and your help is greatly appreciated.
Zinat,
Thank
I
you.
forgot to tell you
Gee.
that next month, on 15th and 16th January 2021, there will be a conference, second public health conference through the APNA Public Health Institute.
Gee.
And that the theme is COVID-19 pandemic. So there are a lot of session on this thing on 15th and 16th January. The last date for submission of abstract is December 31st. So I think the question was that how to do the make the lectures or how to teach the student through this pandemic. They will discuss many topics will be there over there. This the conference will be on 15 and 16 January 2021. Second public health conference through the APNA.
Perfect. Great.
Institute of Public.
Yeah, we can share this flyer with the membership, Dr. Nazir.
So there is also a question I'm looking at, if anyone wants to answer, that is this good to do? Is it useful to do research these days that has no COVID mention? Can someone answer it? Dishan or Irfan or Ahmed?
Yes, of course, we can do.
The answer would be yes, isn't it? The answer would be
yes. Of course. You can do whatever you want to do.
Your interest is, if you are, COVID is obviously current, so there's a lot of interest in COVID. It might get published as well. So the thing is, if you if you want to do something new and novel, then yes, COVID might be it. But just do not ignore our medicine before and after COVID, because we still have a lot of other problems as well in other specialties.
Yeah, the COVID is a new thing, so that's why it's more highly chances that that can be published easily. And also, like I was checking other day last week for the funding, 90% of the funding at this point regarding the COVID study. So there's a more opportunity if you want to do something on COVID, but definitely whatever is your interest, you can still do that.
Yeah,
I agree.
And it's a learning process, whatever project you do, you learn and then get better at it.
Exactly.
Fatma, and you ask a good question there too. That yes, the journals are backlogged, but they will catch up, because obviously this year was tough. So you might hear back from them because they're catching up now. So it's going to improve, with the arrival of the vaccine as well. So I think the workflow in those, and yes, there are a lot of backlogged because I think a lot of reviewers, were busy. They had to double shift their clinic duties. So yes, you will see some movement now more in terms of journal acceptance.
And just to let you know, while you were talking about PP and communication skills, I have shared a document called National Healthcare Communication Program from NHS. So that gives you some insight into how you can still communicate well enough, although you are wearing PPE. So that's a national document from the UK. So anybody, it's available online as well.
Is there any journals that you may suggest for students which are more student friendly?
JSMU journal.
Kashif, do you have any general
Yes, I would suggest to go for medical, in terms of, because my field is education, but Medical Science Educator, which is a journal of the International Association of Medical Science Educators. There are also journals like that if you Google. But as Dr. Sulaiman was saying, Irfan is saying that you have local journals as well. Some residencies would just want to see that you have published something, right? But if you want to look at more competitive residency, and I know that Zishan or someone, I can't remember, someone said there are students who come say, oh, I cannot get into neurological surgery because I don't have any. So you can start small, you can start submitting in local journals, but you can also start looking at some conferences that actually support student section. They even give you a travel grant to attend, and so there are opportunities there. But yeah.
So I think that at the level of the residency, they like to see like if you have any published or anything done, if you have that germs, because when we apply for a residency, I don't have any abstract, I don't have any paper published.
Right.
So that section was completely blank. The purpose of doing this conference is to encourage the students to do some activity, and even as Kashif said, like submit it in the local journal, university journal, and mention in your CV that you have these jumps. That's they're looking for.
Yeah, and collaborate. I mean, if obviously even with the current situation, if you cannot do it firsthand, collaborate with people like us. I mean, here, I mean, wherever. I mean, have your name on the paper. Do some data back end data mining or something, which will be a part. You can become a part of that. So again, anything would be useful.
Another question with the similar theme is it beneficial to do medical education research? I keep putting it off to make time for clinical research more. So
I've actually just replied to that question by saying it's
okay.
absolutely fine to do research in medical education. I think,
right,
especially in the UK, if you go for a job which has got an academic component to it, and you need to have some sort of evidence that this is where your teaching profile is. Just saying that I love teaching may not work anymore. There all should be a portfolio or a teaching profile. And if you combine it with a master's program by doing a master's in medical education, then you've got both research, plus you get a master's at the end of it. So I think it's down to personal interest. It may not be everybody's cup of tea, but it's very difficult to do clinical work and then do a master's. And trust me, I tried doing it twice, and it's just not easy. In the UK, I'm not sure how things are in America, but it's tough. But I would always suggest to do it part-time. That's how I would now suggest. Always do masters part-time.
Yeah, and I would just give like 2 points to that Ridwanbhai and Dr. Amir. Is like two of my, I mean, again, Kashif is one example. I'm not an educator from that perspective, but I still teach at the local university. Two of my class fellows, I mean, one is the head of research council in Kuwait. I mean, he's responsible for all recruitment, all fellowship, everything. He's an educator. I mean, our class fellow just went through the route Kashif went through and I went through. One of my other class fellows is the head of education at Dow. So again, that if that is your interest, you can achieve much more than with one clinical specialty or other. So again, it all depends on your interest and whether, I mean, specialties are going to go up and down and all that, especially in the US market. Education will always be there.
Yeah, absolutely agree
And
with that.
let me add about the poster presentations, like our residency programs. They did actually the annual residence posters by Zoom, and then the posters were published as well. So this is the new way to get started.
And Ridwanbhai, just one point I forgot to add that, I mean, again, in order to understand and again, looking at research, you don't have to like subscribe to anything formal. I mean, the stuff I do, WebMD and Medscape, those are all like, again, openly available content. That's not research, but you can just Google it, sign it up for free. And again, everything goes to like, I work on that. I curate everything. So all of those researches are there to give you a flavor of how content is done, abstract, basic stuff, 101. You can get it without.
But one thing for the student point of view, one thing I want to say very clearly, that you have to have good writing skills. So when you have all seen that student writing, hey doc, can you please help me with this? Well, that's that type of writing skills. I actually get disappointed and not even reply to these type of emails where you do not know how to address people, or if you don't know someone how to address, and if you know someone how to address. So writing skill, if there is any online writing skill sets or a course you can take it online, please do that, because that is where people are going to know you. Not many people will talk to you and see how you do, but many of them will see what you write in your personal statement, in your emails, and all these things are very, very important.
Yeah, one comment. I think because a lot of students who may not have the background, I think it's good for them to have templates, on the website, like how you write an email. And the other thing that we can also do is, because, as I said, that many of us, including me, who didn't have that background and struggle, although we wanted to learn, but we didn't know how to write. So I think one way could be either to have a bad example and a good example. So 2 templates on the website, both for the...
That's a good suggestion, very good suggestion.
And the other thing that you may find more interesting is a small video dialogue clips. this is a wrong way of doing it, this is a good way of doing it. So because, for our students, who don't have a lot of facilities, I think they really need something very concrete. They really need actually, the halwa,
so
everything.
that's something for Irfan, hopefully, and Zinat to continue on this, that have with some small video clips. That's a great idea.
Yeah.
And some templates available to students on our website.
I think if Zishan or anyone is interested to do these kind of a short presentation, we already doing online lectures, and we already have like all the videos on the JSMU website. So I think that will be very helpful, that we can record it and we can save it on the website, so everyone can have access with that.
I think Zishan and Shazia and Zinat, they all have done a wonderful job to tell us, and Narmana has been doing it for many years also. But we can have a perspective from if you are applying to someone applying for a residency, how to communicate, if you are writing for a research abstract, how to communicate, and so on and so on.
And Zishan, I don't know, it predates your time, but probably most of us remember 50-50. I mean, Sahi Tarika and Galat Tarika. So probably that we need something on those lines.
I think a lot of students don't actually access the library when we do surveys in medical education. They don't really access. We did a survey of 500 students. Only 2 people access the library. The library is a great place for getting resources. And I just put a link for the Purdue online writing workshop that we can put in as a resource, because I think I think that's a great resource, because it kind of gives you what is AMA style, APA style, but also looks at some other techniques of writing. Scientific writing is different, right? But
so if Yunus is still online, I would suggest Yunus or Irfan, whoever is recording this, you can download the chat also. And from that chat, all these resources people have provided today, put it in a one format and put it on website or maybe email to people as well.
Yeah, and last year actually with Dr. Nazir, Professor Nazir, we did a workshop, in-person workshop in JSMU, and we have a different, like a one workshop and the presentation. So our focus is to write, how to write the papers, how to write the case reports and all these things. So which was very helpful. So I think with these other communication skill plus writing, how to write, because if we need to make it more simple for student, as we all have experience when we move to the outside the Pakistan, we have no clue what is the abstract, what is the research, and what they are.
Absolutely.
So we need to think in the same way, like what they know. So we need to go really, really basic stuff to help them to how to start, how to initiate, give them idea. And Dr. Rahat is also a very helpful resource there, and they can communicate. They have a connection with the student who are interested. They can contact us. We can mentor them, and we can guide them how to do whatever we are doing. So I think that will be very helpful. And they are very open. The students are very open for any guidance or any help. So I think that's we need to do.
Yeah, and we can have 2 things, one, mostly 80-90% are, for posters and basic, but we can also have advanced research fellowship, so people who may have more experience, so you're not ignoring them too. So maybe, but I know, based on the background, a lot of people will get benefit with small posters, low hanging fruits, but also to have, if someone has that background, or if someone wants to explore, maybe have some fellowship. So at the Nishtar Alumni, as I said, that I'm the chair for the Research Council. So what we are doing is that we are selecting class representative from each medical class, a male and a female. So that will be our representation at Nishtar. And then we are in the process of selecting 2 PGRs from each unit. And then try to, and then hopefully trying to build some fellowship. Yeah. So there's a couple of things, that can be easily done, but I think those are very, very helpful with the small things. Yeah.
Wonderful.
What I'm hearing is, I think what's happened, that we've come together under difficult circumstances, but still trying to do what we can do best for our junior colleagues, which did happen in the past, but not to that extent. We have to be honest about it, because we learned the hard way in a way. But now we are here trying to give something back to our medical schools and students and junior doctors, and it's there for the taking. So if anybody wants to get in touch with me, I'm very informal. They can get in touch with me, email That's what I
Super.
We can help them. I took something away. I must say, before I forget, I must say I've learned a beautiful line today from Shazia Masood, which was, you have to speak 2 languages. One is English, the other one is body.
Body.
Such a powerful statement, which I will be using in my talks with the students, with your permission, Shazia.
Inshallah, inshallah. Sure, absolutely.
Because we all just, I spoke more Punjabi in Birmingham than I spoke in Pakistan. I'm not a Punjabi.
Wow.
I learned Sindhi in Karachi as a language.
Yes.
I learned languages because languages break the barriers between people. But,
absolutely.
So I would say,
correct me if I'm wrong, there are so many accents in the UK as opposed to America.
Yes.
So one of my closing remarks is always that organisms who adopt survives. So I think we are adopting also.
Yes.
That is a great saying that yes, if he is still doing these small meeting, in-person meeting, there is no way to collect so many people from so many places. So that's what we adopt.
This is the new hybrid look of JSM Yana.
That's right. And all the support. It's just amazing how much you all have come together and supported our alma mater, and really appreciate it, and really appreciate Amir Barney and Zishan coming together, and supporting our cause. And it is all the students. It's for every student that wants to have access. So thank you so much.
Thank you very much.
Sorry, I can't open my chat for some reason. I've been typing a lot, so I just thought I'd pop in for a minute and say thank you to all of you. I'm a third-year medical student at SMC, and I just wanted to say that I'm extremely grateful to Dr. Zishan today, because his line about being forgiving to yourself, I'm sorry, that was very emotional. I have to mention that. Sorry if my voice is cracking, but it was really emotional. Thank you so much for that.
And just to let you know, Zishan is doing another seminar tomorrow for just general public developmental.
I wish I could attend, but I have something so serious tomorrow. But I wish I could attend. Thank you so much.
Zishan, you can be the next Gusta Cali of the modern world. The motivational speaker, or even better, I would say. And I'm surprised that why you are just a child specialist. You are a perfect example of what a good adult psychiatrist should be doing. I'm sure everybody will agree with me.
So
He's an infant
As a
specialist.
child secretary, you get trained in adult and child, but thank you so much.
Yes.
Those are
Yeah. I mean, I was thinking of a list of people that would be interested in talking to you after your talk.
I love to. Yeah. Anyone.
Thank you so very much.
All right.
I just wanted to mention that the last slide of my presentation has the good scenarios and bad scenario videos all linked on that. So you can put it on the link so everybody can see them.
Perfect.
Okay, great. And at the last, I want to say thanks again for Dr. Nazir from JSMU and Dr. Rahat Naz from JSMU. Thank you so much for your support.
Thank you, everybody.
Thank you.
Okay.
Thank you, everybody. God bless. Jazakallah khair.
Thank you.
Thank you.